Happy Sunday, everybody. Thank you for joining me today for a great live session. I see already we have a lot of people waiting for the live to start off in the comment section, and appreciate everyone taking time after a big Valentine's evening, I'm sure. Comment over the right how many people went out for Valentine's last night. So maybe I caught you at a good hour. We're starting a little later than normal. And we're going to get to a lot of Q&A today. Yes, I wore this shirt for the Valentine's party last night here in Miami, and I did take it off, went to bed, and re-put it back on. For anyone who saw me last night, I'm not just getting home. So, but anyway, I guess black was also a Valentine's wear that I didn't know, but this is what I wore. So if you went out for Valentine's, let us know what you did. It was a big night here. Of course, Miami, everything was booked and solid, packed up. So we're going to have a fun, casual Sunday morning. We got a lot of cool stuff for you guys. I heard everyone all week long, the things for 2026 that you wanted me to go through. We put some specials together for you. As always, we'll do a bunch of Q&A. And I mentioned I'm in Miami. For those that don't know, there's a huge Congress here in Miami. And the nice part about this Congress is there's people from all over the world. So I think because Miami is central to obviously Europe and Central America, a lot of people easily get to Miami. When I'm over in LA, it tends to be mostly American. So it's really cool talking to everyone yesterday. And of course, I had a big lecture. And I'll give you some information that I learned yesterday. As you know, you learn things when you go to the lecture because I go to other lectures. But as I always tell you guys, it's at 9, 10, 11, 12 at night when you learn everything after someone's had a tequila drink and they've done the lecture on the product or they've done the study. A lot of people here have done the studies on new products coming through. Things you ask me, Elicor, the new fat transfers like Aloclay and Renuva. Renuva is not new, but there's a whole host coming. We can talk about that today. But it's in the evening time where you learn exactly what happened behind the scenes. So I know it takes a lot of work to come to these and to stay out late and do all the networking, but I did it yesterday. I'll do it tonight. And today I'll share some of what I learned yesterday. And it has to do with lower face aging. So it's very pertinent to what today talks about because you think it's just you guys and myself that's worried about our lower face. And one of the gals came over last night and offered me an Ulthera today. But I'll get my lower face done, but I'm not going to do my forehead or my lower neck. We can talk about why. That's ultrasound, and that goes into RF. The other thing I talked about yesterday, I talked to a few companies from Korea. You guys all asked me about Zerf. And so I talked to a bunch of people from Korea who have products that are just entering the market, RF, for lower face. And I talked about all the products in Korea and what's coming over, and I have some exciting things. I'll be in Korea in 2 weeks working with them, so we can talk about that. But understand there's ultrasound in RF. And so today's run of show, and I do see all the comments, please help our lower face. I'm going to go through it today. And we can go as deep as you want. I don't have a lecture till later today. I don't have any commitments for the next couple hours, so we can go as deep as you want. Understand, someone commented on one of the videos this morning, hey, Rajani, you go into too much detail in your videos. So videos that I'm talking about the 10 to 12 minute, sometimes 7-minute videos on YouTube. I much rather go for 30 minutes in a video because I can give you real information that's pertinent to you. For me to make a 8-minute video, that takes me work. All of a sudden I got to think how to carve that out so it's proper. It gives you value and it's true. So it's way easier for me to go 30 minutes than 10 minutes. But for those that want shorter videos, I apologize. It's hard to get the information I give you in 4 minutes. It's going to be worthwhile. So, and some of you like studies. So for today, everything on the site, what I'm going to do, there's a discount code. I'll tell you how to get it in a minute. But everything's 10% off for you guys all across the board. That's one easy thing. So you don't have to think too hard about, oh, I want this device or that device. And everyone has an element of happiness for Valentine's Day. And then I put together some specific lower face aging packages. You're going to get access to that when we give you the discount code too, which I'm not going to hold you hostage here. We're going to give it to you right after this slide. The other thing is everyone gets a free Nectifirm. Nectifirm is a cream. I'm going to go through it. Just by chance, I was literally filming outside by the golf course before my lecture, and I talked to one of the executives from Revision Skincare. We talked about the DEJ booster. Nectifirm looks like this, and got some data on that and some cool things that are coming. But Nectifirm, you get a free Nectifirm that's worth $250. For any order over $250, you get a free Nectifirm. We'll go into why facial aging happens. I have a giveaway for you today. You guys said you love the giveaways, so we have one of those. And then, of course, I'm going to answer your questions along the way. And again, understand I'm here at this conference. That's part of what I do for a living. Obviously, I have clients. We have skincare lines. I lecture, teach. I have online courses. It's all part of everything that I do. But my goal with these for 2025 and 6, especially now, my commitment to you guys is to give you value on exactly what you guys want to know. A majority rules. And I know layering is something you guys have asked me to cover too. So we're going to, over the year, do all of that. Yeah. So Jennifer, yeah, you ordered the gua sha. I'm in a hotel, obviously. You guys would probably tell that now. These water bottles, by the way, it's $40 for water. I had to look up this morning. If you're from Miami, tell me, can you drink the tap water here? I come into these cities, I'm scared, but for $40, I'd rather not drink the water. I'd rather drink it out of the tap. But I don't leave home without my gua sha for sure. It's an addiction, I will tell you. And so yes, gua sha, good for you. Longer videos are the best. That's really cool. I do appreciate the feedback. I just know longer videos, we might get 3, 4, 5, 6,000 views. The shorter ones, people just want to be told what to do, but there's no one what to do. That's my world I live in, and I apologize for that. I could say, here, put this in your mouth and you're going to look 40 years younger. I could do that to you guys, but that's not true. So we'll go through it all. Yes. Okay. You lived in Miami for 3 years. I can drink the tap water. I made my coffee this morning with my Keurig. So I did use the tap water, figured it would heat and sterilize it. But yeah, some places, Japan has great tap water. So agree. Yeah. Enjoy. Yeah. Okay. So that's what we have going. So the discount code, here's a really cool method, because you guys ask for this, an easy way to get discount codes and not be confused by it all. We have a text line set up, and we'll use this going forward. So to get the discount code, very easy, because I know everyone watching here, you might not have a computer, but you have a phone. 541-287-7384, and you can just DM. So you're texting that number, LIVE, live, easy. Just like we do sometimes on Instagram, we give you one keyword and then we send you details and videos. You're just going to text it with your phone. And that way, for many of you watching, I know many of you watch on laptops. People are now watching YouTube on TVs. It's a big trend. And at the end, of course, before I'll do some Q&As. At the end, we'll go through the giveaway. It's over $1,000. And then I'll stay and answer some Q&As until my phone rings and I have to go down to the exhibit hall and do some work for some people. But I'll stay with you and do Q&As after the giveaway. And here it is here. You saw the giveaway. You guys can throw that up again. Throw the giveaway up. I'll go through it so you guys know. Reebok's Line Relaxer. You can see that nice, the head on that product. The Nectifirm, it looks like. The lip and mouth, and then Plasmazomes. I do want to go through that because one of the big topics of conversation here in Miami, and that I've been following with you for a while, is synthetic fat. So let me just say this. In the next 2 years, your guys' minds are going to be blown away, because my mind's blown away. So I know you guys will be like as shocked as I am, or surprised in a good way. Over the next 2 years, a lot's going to happen in aesthetics. But one of the things is injectable fat. Not fillers, but fat. And things like Renuva and Alloclay that are out there. But you guys know my concern for myself and for you guys is, of course, something called prions and virions that can be in that product. And we can talk more about that. But synthetic products that don't come from cadavers or dead people, but are made. Plasmasomes are is a microneedling system that I made in an FDA monitored lab to microneedle in. And they're synthetic exosomes because I realize many of you don't want mRNA, RNA, DNA from other people, and not all exosomes are good signals. So I put 7 skin signals that are made without any human genetic material in the dermal roller system. So that's included in there. We can talk about that. We don't spend enough talking about that, but that has to do with the lower face. So that's today. We're going to do all of that today. I don't use TikTok, so I can't get an entry for TikTok. No, we're not doing this on TikTok. You don't need TikTok here. By the way, there was a big to do about a lot of doctors who apparently are being banned on TikTok with the new algorithm because Larry Ellison and I'm spacing on Larry's company. Why am I spacing on that? Took over the TikTok algorithm, right? So a lot of doctors they're being banned. And so what's happening is a lot of the TikTok stuff you're seeing is the stuff that says, throw that in your mouth, bite on it, and you're going to look 30 years younger. So I don't know where that leaves TikTok for people like us who want real information. So let's go to a poll. Let's engage. Let's do something right now. I want to find out some information from you before we get started. I'll go through a couple of products, and then you guys know I'll keep that text line up for those that want to text. But on that banner, you guys, for my team, you put what they need to text. So put live in that banner, so that they just don't have the text number, but they know what to do with the text number. Love all my shiny shirts. This is they told me you're going to a Valentine's party. I didn't know what to wear to a Valentine's party, so I figured pink. So that's what I wore. So anyway, that's where this comes from. I don't have many pink shirts. So let's get into it a little bit. But what's your biggest device confusion? And you think I might know this by now, and I do hear some of your questions, but on the lives, we have a different crew of people. So if you guys want to move me, thank you. Order what goes first, okay? Are you most confused? I don't mean that in a negative way. I mean, I'm confused right now. Look what's coming at me, right? Confused isn't negative. It means, what do I need more education on? What goes first? How often to use something? And I know you have that question on red light. We should talk about that. Pairing. What can be mixed? There's no question. How can you not be confused on that? That's very specific. It has to do with pHs mainly. And product choice. So what do you use? And I keep a very, very tight group of products on my store. I'm not one of these people that has my makeup line. I don't wear makeup, but if I did, my makeup line, my shoe line, my clothing, my ball caps, I don't have any of that on there. We keep a tight group of products. And in fact, in talking to the Koreans yesterday, that's one of the things why they like to work with us, is because we don't have a lot of stuff, and it's a very tight group of only the things we test and know and feel comfortable with, and that I use myself. It's why synthetic fat right now, I don't give it to my patients, so I'm not saying you should do it. So what I see in the answers, let's go through. Let me scroll a little bit so I get a feel. A and D, A and B, A and C. Let's see who's going to win here. B and C, B, C, A, D. That's what you guys always tell me, everything. You always tell me everything. That's what makes my life difficult. Do it all. A and C. Bring up the questions again so I can see what A. It seems like A and C are common. Let's see what A and C were. So A was order. So what goes first? I agree with that for sure. C, pairing. What can't be mixed? I think that's a great one. Okay, good. That sets me up to go through a few things. So we can dive into it. I would say they'll pull the answers up and tell me what the number one was. But I love how you guys took 2. You didn't pick one answer. You guys always do that to me. All of it. Do you want a video on this or that? Both. They do that to me here at the shows, like in Miami too. I'm like, what do you want me to lecture on, this or that, or do it all? And there's even lectures tomorrow that people didn't show up there. Can you do that lecture? So luckily, I have a broad scope of knowledge. I can do that stuff. But of course, putting lectures together, AI is a little easier. But okay, so let's just for a minute talk about lower face face aging, we'll spend a couple minutes because this is, and like I said, if I go down there and they have that slot open and I do my Ulthera, I'm only going to do my lower face. Of course, lifting things through the upper face by filling, adding fat or different things does lift here. But the best way to do that is in the hockey stick back here because we want a sharper jawline. That's the opportunity to lift. If you start doing it in the mid face, temples you can fill, great, they're going to look great, but you can't fill enough to lift the lower face and the temple. The temple doesn't have much gain. And by the way, stuff I can't talk about because people talk to me about stuff, they don't make me sign NDAs because they know I'm like that. So, but there is, I'll put it this way, there's some pretty cool stuff coming for the temple for you guys. And it's not going to be far off. It's probably in the next month, but really rolled out in April. And I'll be going to a big event on that. So that's the temple. But when you fill or you volumize the temple, which does make us look younger, it's going to more lift the edge of the eye. If you start filling the face here to lift the jowl, you can do it a little bit, but that's where the unusual look comes from. So we've really gotten away from the high cheek because of the baby face. And by the way, I presented that yesterday, and other companies, as you might imagine, are just stealing that. A bunch of toxin people. And you go look on YouTube, I'm the first one to talk about the baby face. And that triggered people because they said the baby face. They didn't like the word, but you're seeing the baby glow, baby tox, baby this, baby everything all over the place. But what that means is the lack of that high aging lateral cheek that all the models have, they start to look older quicker because then they have the buccal hollow here, preauricular hollow. So this is the zone that you can fill and not look unusual to pick up the lower jawline and face. And biostimulators are part of what we use. Someone's mentioning threads there. Let me tell you something I presented yesterday, because threads should be making a comeback. And yesterday I went through smooth in the lectures and twist threads, but here's something that people don't think of. And what's the correct word here? My vocabulary is a little low today. Portrays into microneedling, because part of what I demonstrated yesterday was when you put a smooth thread in the face, and amazingly, when I polled the audience yesterday, so many people in America started with lifting threads, but the thread itself increased from baseline, from controls, transforming growth factor beta. Probably one of the most important growth factors in your face because it tells the bricks to build. It tells the bricklayer to do what to do. And we demonstrated that, transforming growth factor beta, TGF beta, probably the most important. And you're going to think PDGF is the most important, okay? Growth factor, because companies have it and they told you that, but it's not. It's transforming growth factor and vascular endothelial growth factor, probably the most important two of 40-ish that are in your body, 40 growth factors. So don't think of threads as an example of just lifting. They build collagen. We know type 1 and 2 is what I demonstrated yesterday, but we know type 1, 2, and 3. This is studied. But what it does to your matrix metalloproteinases, elastases, and collagenase that breaks down your collagen, that's more important than the thread. Let me transform that to your microneedling. Microneedling does the same, and you should be using stainless steel rollers because they're not porous. That's what come with my kits. Not titanium, because titanium are porous. Okay, so yes, there are a lot of people copying not just Babyface, but your Q&A lives, or copy your topics to post videos. You're the OG. You guys know, thank you, Vivian. I don't look at myself like the OG or anything like that, but I do what I do because I have fun with it and we run with it. But it does a little bit. Like I walked in yesterday in Paris, they had a toxin filler company had the Babyface up on a big, what do you call it, banner. And I'm like, you feel like for a minute, well, I'm the first one talking about the Babyface because it's how I saw the transformations of what people wanted. So I go over and I tell them, give them a few choice words, and I banter back and forth, but I still like them. That's okay. It's how it goes. You just take it as a compliment. But anyway, that's how it goes. But we laugh about it at the end of the day. I had smooth threads peri-orally several years ago, and it gave me severe bruising. Yeah, and no discernible benefits. Okay, so Threads can bruise because you're putting a needle all through the way. But remember, you can get cannula threads. I presented yesterday. And also remember, it may have done things you don't know, and you may have only had one session. You need 2 or 3. So there's a lot that goes in there. And then you need 3D imaging if you're going to try and see results from one session of threads. And I'm not this big thread advocate. I'm saying they play a huge role if done properly. Let's go into the first product. Okay, here's one more question. Need help with vertical lip lines would be amazing. Let me go into something. I'm on the road here, and I'm leaving here for Asia, Hong Kong, and Korea, and everywhere. So I don't have a lot of stuff with me, but this is Revision. This is their black packaging. One of the products that we're talking about today, and that's on sale, it's in the giveaways, Reeboks Line Relaxer. And that's now been around for a few years, and I was offered a spot to do part of that study. I think there was 5 centers that did that study on Reeboks Line Relaxer. If we can put a picture of that up, but that's one of the products that's going to help you. We're talking vertical lip lines here. Where the study was, what we did in that revision study was we did around the eyes, because there's 7 peptides in it, proprietary, it's patented peptides that slow down your acetylcholine release. That's what Botox does. At the presynaptic nerve terminal, it stops the release of acetylcholine so you don't fire the nerve. Okay. The problem with that is you get muscle atrophy. The problem is you can get drooping and so on. But there's peptides in Reeboks Line Relaxer that slow down muscle movement. There's hyaluronic acid in it as well, and some antioxidants to increase. It's been shown to increase elasticity and collagen. But most importantly, has those group of peptides. Why does that matter around the lips? Well, lip lines are from a hyperdynamic orbicularis oris. That's the muscle, very thin, circles the mouth. We dissect that out all the time in anatomy labs, just like the circular one around the eye that's called the orbicularis oculi. Very thin. When you dissect down through the face, sometimes that muscle, it's paper thin. Okay, so look, the muscle around your eye, see me move there? It's thin, it's as thin as that paper. So when you dissect it out, their muscle might not be here, but it's over here. You can skip areas. But that's where Reeboks Line Relaxer was studied. And with and without toxin, meaning Botox and Dysport. Latibo's the Korean one, great product. You'll see more and more. I talked to those guys yesterday. That Reeboks Line Relaxer is great for around the mouth. Understanding, and this is the complexity, why I talk to you in longer videos than shorter. The Reeboks is going to help the skin, thicken the dermis, help elasticity and collagen, like a 20-year-old doesn't have lip lines, not because they don't have movement, because they have volume and elasticity. But when you slow the movement down a little bit, it slows your lip lines. So Reeboks works great around the eyes, but also for the lower face. And we have a nasolabial before and after too that you'll see, because a lot of people do say it helps with nasolabial folds because there is a dynamic component. Here you can see here, look at the lip lines. So it's multifactorial, of course. There's loss of a bit of fat. There's increase what we call hyperdynamics. Why would you become hyperdynamic around the mouth, especially women, especially after 45, because estrogen is going down? It's because of bone. Okay. So when you lose bone, and we talked about this in the lectures all day, around your teeth is something called alveolar bone. That's going to lead me into paying attention to your lower face, your teeth cleaning, but also where red light comes in. And there's over 100 papers. I'm putting a video together for all you guys. I don't know when I'll be done of it, on lower face gingivitis, let me say. Gingivitis, gum disease, lower face bone, and the red light studies that we have to date. There's over 100. But one of the best is a review study that I just looked at this morning again. And what does red light do to the gums? I said 40% of people have gingivitis. We had the dental hygienist come on very upset. No, it's 60%. I look it up. Some of the numbers are as high as 70%. Why are we all right? Because as we age, the gingivitis goes up. Of course, smoking plays a role. What you eat, brushing your teeth, plaque, all the things we can go to. But the bottom line is red light does what, and what's been shown in the studies for the gums? red light has been shown, it's been shown for pain. That's a big part of the studies, but it's been shown to decrease inflammation. And you guys know decreasing inflammation decreases all the bad things in your mouth, okay? Because gingivitis causes alveolar bone, and that's the bone around your teeth. That's the bone we want to keep. But as you lose alveolar bone, you lose jaw. So anyone who's had a tooth removed, you're like, Rajani, say no more, because you know what it does. But gingivitis is like that. And so you don't have to go to the dental hygienist every 6 months or even every year if you take care of your home program. There's a lot of things you can do at home. Talk about the water pick, of course, flossing, brushing. And a lot of people don't use toothpaste. Do you really need toothpaste? A lot of people say no. So a lot of people don't like the impurities in commercial toothpaste. So it's a big deal. It's a big story. Bottom line is red light increases your cytochrome oxidase, increases the energy, and there's over 100 papers what it does in the mouth. But it's a huge part. If you can maintain your bone to where you were 30, 40, or 50, when you're 70 or 80, your lower face is going to look way different. I put a question up the other day. Someone said, Rajani, had a facelift. It's a year later. I still look old. Use that terminology. Of course, facelift's going to pull the skin. But if you're pulling the skin on the bone that's deformed, remodeled, reshaped, you're going to have that shape of the bone. So understand how complex. It's fat, it's muscle, it's bone. When I'm going to, I don't know if I can tell you where I'm going right now, but after I'll send you some pictures. But one of the things we're looking at over in this country is bone. And we're going to look at effects of something on bone because it's so important. So bone, fat, and muscle. And we're looking at muscle effects of the lower face. That muscle pulls down, this one pulls up. And I did this yesterday in Miami. I had a good conversation with a facial muscle expert who's also an expert in light. So I don't want to go on about how important that is, but if you imagine, if you lost the pull of muscle on your bone, you're going to start losing bone. And so you can't just Botox your face, you're going to have bone loss. Okay, so it's important, but we're going to be looking at that. And there's more to come for you guys on that. Does red light help maintain the jawbone and help prevent any further bone loss? It's a great direct question that you ask. I would say we do not have a direct study right now that looks at bone over time and red light and says definitively bone, if you shine red light on bone over 20 years, because your bone remodels not overnight, even though some of you think it will, unless you had a procedure done, a tooth removed or something, or bad gingivitis, it takes years. To study something like that's very hard. And there's what we call compounding variables. Are you on estrogen? Are you a smoker? All those compounding variables. That study would be about $10, $20 million, and you'll never make that up in the red light device that you studied it. However, what does everything point to? Absolutely. Gingivitis, loss of alveolar bone, that leads to bone loss. It leads to lower facial aging. And you don't need a study to tell you, because I guarantee in the comments, people who've lost tooth have had gingivitis. When you go into the dentist, they lift your gums up and they say 3, 3, 4, 3, 3, 2, 2, 3. Then that you're seeing changes in your lower face. That's gum retraction, gingivitis. There is studies absolutely showing removal of plaque, superficial and deep, and then with and without use of red light. Red light went out. Statistically significantly less inflammation in gingivitis. That's a study I'll present in a video to you. So, and then K2D3, vibration's another one. Did that video go up? Yeah, that was last Sunday's video with half bone on the face. Vibration is very interesting, studying vibration on the face. People say, well, Johnny, you're going to now sell something with vibration. I've sold things with vibration for 25 years. So microdermabrasion, Vibrox, Prime, those facials all have vibration in them. And I've been doing that for 25 years. So no, I'm not adding anything with vibration and then telling you it stops bone loss. We've used vibration in the face forever. But absolutely. I buy extra toothpaste, extra bonuses, minus for both restrooms, extra importance. Buy extra toothpaste, extra bonuses. I didn't understand that one quite, but PRF Easy Gel and Sculptor can help rebuild the jawline definition also. Yeah, I'm going to say yes to that. Absolutely. We saw it on 3D imaging yesterday. It wasn't my images. Someone else come up and presented Easy Gel, and this person put Easy Gel along the jawline, and it lifted the face. And there's 3D imaging showing an improvement. But absolutely, because understand. Again, I hate to sound complex, and you guys tell me in the comments. I feel like just boring stuff. But when you use PRF, and I had Canadians in the room, people from Central American, Europeans that had all kinds of different spins and techniques for spinning blood. But when you use PRF, you have no additives. You've got your own exosomes. 40, we've demonstrated 8 growth factors in PRF, but there's 40 in the body. Likely they're there, but we've demonstrated 8 of the most important ones, including TGF beta. You have mesenchymal stem cells. Okay, that's why with a facelift, you're often going to want to get fat put in, even if the fat doesn't take. Fat is rich in mesenchymal stem cells. That's why I use fat transfer to rejuvenate your bone, your face, your skin. All those mesenchymal stem cells, they're ready to form all the things that you stimulate. And one of the things you're stimulating is bone. That's why a lot of people like myself, we put Sculptra on bone. It's the most important place to put Sculptra, on the bone, including soft tissue. So, but if you want to talk about vibration, many of you have vibration plates. I did a video on that. Gua Sha has vibration. We have new products coming out with vibration. But I see it. I use it. You guys all use it. But I always have the ability to turn vibration off because I know some people don't like the feel of vibration. Having Botox lip flip and corners this week. Okay, I'll tell you what that means. Ouch. What are the downsides? Don't say ouch because you're hardly going to feel it. Although, yes, I retract that statement. The probably one of the most sensitive injections is going to be around the lips, but go in and maybe 10 minutes early because it's a very thin dermal thickness around the lip. You don't need a lot of topical on there for a long time, but it'll be pretty quick. And the lip flip will flip the lip a little bit, but most importantly for me and my clients is it slows down that muscle movement. So if you're getting that done, really consider getting Revox Line Relaxer and use that, because this has been studied around the eyes, use that with the toxin around the lip. Why? Because you want your toxin to last longer, and it's been proven. This is a study done with Revox Line Relaxer and with toxin around the eyes. It'll make it last longer. It works better. Why can't you just go put 16 units around the lip? Because we use 6. The max patient I ever had was 10 or 12, but you can't go use more than 6 to 8 units in a human being because they won't be able to talk, whistle, or most importantly, hold their food in when they eat. So they'll lose those 3 things if you go up in dose. By using a low dose, that means you're going to lose longevity. So to get the lips done, you're going to need it done. I don't know your age and how much fat loss you have or bone loss, but you're going to be happiest having it done every 2 months. It's not going to last like my toxin around my eyes. I might do once every year or 2, but the lips, which I do not do toxin around the lips, it's only going to last you about 8 weeks. So use something with it, and less is more. Love your Gua Sha 100% makes a difference daily. 100% for me and 100% for you. I'm very cautious to, who's done the trial on a Gua Sha device to say people look younger in 10 years from using it. That's a $5 million study taking out the confounding variables. But talk to people who use it. Look in the comments. And for $20 or one of mine, this is on special today. I'm throwing out a number. I don't know. I think it's like with the glow, it's $120, $130, $129, $130. Vibration, okay? So you got your vibration, that's done. You got red light and near infrared. Then you have red light without vibration, and then you have just vibration alone. But more importantly, you have a corrugated end that fits perfectly for one of the most important bones in the face, and that's your maxillary bone right here. Most important bone. And there you can see the red light demonstration. So, and of course, I just take this because I don't have time every morning to use the lip and mouth. And I take this and I run it. You don't have to touch the lips, okay? Because you want red lips. That's youthful. You want to keep your volume in your lips, and you don't have to touch your lips. And there you go. You have it on your lips, and you have red light. So it's designed with all those things in mind. And of course, this is the most important part right here. Okay, the neck, which is what we're talking about today. So I digress, but yes. So that's another one. And let's talk about this because I just saw a question on the NUA because we're talking lower face. This is so important. See, maybe you can find it. It's down near the bottom about NUA, and I can give you some updated information on that. But NUA is radio frequency. I don't know, maybe my team can find that question, put it up. But NUA is on special today as well. But if you really have some significant lower face aging, you don't want a facelift. Facelifts are good for the lower face, especially if you have good jawbone. It's not going to pull and narrow it too much. But facelifts at a certain point, if you want the perfect snatched lower face and you're 55, 65 plus and you have significant laxity, then facelifts are great. 99.99% of people can't afford the $50,000 to $250,000. They don't want the surgery, the downtime, the risk, the nerve damage. So something like NUA is your RF. Your main two choices with energy based, and you're going to have to do that if you have a lot of sag. Start with gua sha and red light. Start with the lip and mouth device, but you probably with significant, you're going to go to RF or ultrasound. RF, you know, Thermage. Zerf is the one I did a video, new one. There's a better one coming from Korea that I can't tell you about right now, but coming. And then there's ultrasound like Ulthera and I always forget. And Endolift is laser. Spacing on the only other ultrasound we have, I'll think of it I'll be down at their booth today. But there's two ultrasounds that you get in clinics in the US, but it's ultrasound or RF. New is RF. And of course, you want to be able to know that it's not going to heat too much. So if I go down there and they have an opening, I get my Ulthera in my lower face and jawline. Why won't I get the lower face and the forehead? Because I'm happy with them and I don't want to lose the fat. I'm doing a good job of the lower neck and the forehead. And I do no Botox or anything in my forehead. But why mess with what I'm happy with? You don't, especially with heat. NUA has a shut off. So it protects, you can use that daily or even 3 times a week, all you need for 5, 10, 15 minutes. But again, it's that hockey stick area. And if you look, EndyMed, they're going to be down here today. Where am I? I'm in Miami in the hotel room for those of you who missed the beginning. And downstairs, a big exhibit hall. I can't walk through there. Of course, everyone wants to tell me about what they have. They want a video done. But the positive for me and you guys is I get the deep and dirty education from all those companies. But it's impossible for me to walk around without, it would take me 2 days because everyone wants to stop me and tell me their pitch and they want me to come tell you. But this NUA device, look at these here. These are the heads on the device that you're seeing. So there's 3 on one side, 3 on the other. And I talked about with Zerf from the video, all you guys wanted me to do, which I did. They have 2 different radio frequencies for different depths. NUA has 3. It's an at-home device, shuts off when it gets too hot, which is around 42 degrees Celsius. Okay. And this is a home device. Let me tell you one thing about this device. You can't get it in the majority. There's 187 countries in the world. Someone can look that up, see how incorrect I am. Some countries don't have country status, so they're not counted. But there's 180 some countries around the world. I think there's 2 or 3 where you can go in and buy NUA, and the US is one of them. And so you guys have access to RF. Now you're going to want ultrasound that's available in Korea. You want ultrasound, great. The only reason you want it is because you can't have it. Some of the ultrasound devices they have in Korea and Asia and all over are good, but you have RF. Most of the world has no access to NUA, and you guys do, and it's right there. So I have the ones that are the color of my shirt. I got a bunch more for you guys so we don't run out. And it's the cordless one. 90% of you want the cordless. There it is. What do you guys call that? Lavender, maybe? And it comes with the gel. If you purchase a NUA, do I also need the lip device, or will the NUA be able to increase the volume in the lips? NUA, okay, so I think I got the name for this. So if you go in the trademark website, which trademark did I get? Lip RF, RF lip. Trademarks, I don't even know which one. But I use with clients in-clinic devices for radio frequency on the lip. So Plump RF is the one I comes to my mind. Plump RF. I think I own that one because RF works so good on the lips. So NUA can't tell you to use it in men because they didn't study it. They didn't study it in lips, okay? They didn't study it in the lower neck. They can't tell you. I use it in clinic. My clients use it. I can tell you that I do it. Okay, you do what you want. But yes, RF works great on the lips. Of course it does. And lip lines. Do you still need the lip and mouth device? This is, I travel with this, by the way, because, so do you still need it? Yes. This is a totally different mechanism. And the complexity of everything I'm telling you, if you could come to the lectures with me for a day, like your head's spinning by the end of the day, and then you still have to go out at night, you're going, oh my gosh, I heard all this science. But if you heard how complex lower face aging is, you're going to hit it with 5 different things so that you avoid surgery. So yeah, red light is going to work way different than RF. That's the bottom line. But the way I designed this, okay, this is for your cold sores. You can mix and match. It's teeth whitening, cold sores for this attachment, okay, and then gum. I don't get cold sores, so I do not use the cold sore one, but I use this one, and this is the attachment for red. So that's for your lips. I actually added a 605 nanometer in here. Why? The lip is a mucous membrane. 605 wavelength is more superficial than your 630 and 830, and the lip is superficial. I was talking to, if you know, one of the best IPL guys in the world yesterday, and he said, Rajani, we have so much knowledge in our heads. We have to get this around the world. And I'm saying, yeah, I mean, I'm lecturing to 200 people. I'm on here. We'll have 5,000 by the end of the day. So it's about reaching and getting the information out there. But when I design these products, it's because I'm also in the lectures with the top people in the world with light. I mean, this guy's a wizard. But you can see this red is for the lips, okay? And that has the superficial wavelength for the lips. And then you add in the red light here for the gums. So you can see it has, you can see the lights are different. Let's see, where's my camera? Here versus the lights on the outside. And there's different timings, right? So the outside lips are going to shut off first. Why? Because I know the lips only need a certain dose. And when in the studies on the gums, so when you put this in your mouth for the gums, the studies, just so you guys know, they didn't use laser type of energies. Very low dose worked on the gums. I'll present that in a video to you when I can. And then this is your teeth whitening one, okay? So your wavelength in the 400s is for your teeth whitening. And then you can put, I don't have the whitener on the road with me. I don't use the whitener that much anymore. That's my teeth shade. I don't want them super white, but I can use just the blue light in here, and you'll see it there. So there's the blue light, if you can see. Okay, so I just use the blue light for stains, and I use, for me, maybe every 8 weeks or so, I put a little whitening in the tray at most. Okay, depends how much coffee you're drinking. So you can have your teeth the shade that you want them. I love this question. The models look like teenagers, okay? That the models that I use look like teenagers, whatever that comment was. It's really important to know. I'm walking around here at the conference. I can show you a 55 or 60-year-old gal downstairs. Guys too, but guys don't care as much, it seems. They'll have a beard or something. But there's girls downstairs that are 55, 60. You're going to think they're 40. You're going to think they're 38. They're in the industry. They're doing CO2 laser every 3 months. It costs them nothing. So you're going to see some of the models who look great want to be on camera. And of course, a lot of models who they don't think they look great, and they do. You know, that psychological issue. But at the very end of the day, my point is, when people feel like they don't look good, they don't go on camera and they don't send their pictures into us. And it's very hard to get older people to be willing to show their face. It was easy when I had 1,000 followers. Now we get 8 million views across our channels in a run of a month, more, and nobody wants 8 million people to see them. I don't get on a plane where someone doesn't recognize me. Most people don't want that. Very hard to get models. There's a solution. You can send in your pictures. And I gave that when we started with a lot of these devices, I give you guys the opportunity to send in your pictures and get a free device. And very rarely do people send their pictures in. They're happy, they're stoked, but like, I don't want my picture to be seen. Very hard to get models. So, but you'll be surprised. A lot of our models are 55, 65, but you think they're 40. So there's a lot that goes into that. But you see a lot of your influencers who are on YouTube and Instagram, by the time they hit 55 or 65, you don't see them anymore because of the negative comments they got. Like I get a ton of people. If you had to select just one device to buy for a 50-year-old wanting to keep their skin looking as youthful as possible, what would you recommend? So this is from Emily. See, Emily, I'm not going to say your last name just because I'm very conscious about exposing people. It's a great question. Everyone has that question. The easiest one's going to be an LED mask. And the reason is LED, people think, well, how does LED work for your muscles, for your bones, for your teeth, for your beauty, for your skin? It does all of those things. And your gums, it must be a scam. It's because red light energizes the cell. It works on the cellular level. So people use red light masks all the time because it's easy to do. They can watch TV, you can read while you're doing them. They help around your eyes, the chin, the halo there does your hairline, because you guys asked me to address hair. Okay, plasmasomes you can use on your hair too. So red light's the easiest, quickest one. That's the first one I would buy because you'll use it. NUA is another one right up there, but here's the thing. People drop off. They stop using it after 3 weeks, 4 weeks. They're happy. They see a result, but they drop off because it's labor intensive. You can't do that. Consistency beats. And when you got to go for a facelift because you weren't consistent, you'll say, I wish it was consistent, because you're going to be down. A facelift looks really good at 2 months, 6 months, not so much. By a year to two, what would the number be? I'm going to say 30 or 40%, maybe 80% would like it to look differently than it does. Okay. So facelifts aren't the answer to everything, because facelifts do not thicken the skin. I worked with a bunch of facelift doctors yesterday. They're going to agree with me. Social media, they're not going to agree with you because they want the $100,000 to $250,000. But if you're sitting in a room with them, yeah, facelifts do not thicken your skin. Facelift in and of itself does not add volume to your face. It doesn't get rid of your brown spots. It doesn't get rid of your red spots, your rosacea. It doesn't do anything for your lip size or your vertical lip lines. And it doesn't make your neck skin thicker. It removes your skin. So after you get a facelift, it's going to look great, pick everything up, but you certainly better take care of your skin. The facelift patients walking around downstairs will tell you, hey, my skin down here looked laxity, loose, crepey after 2 years of my facelift, if you don't take care of it. So hopefully that helps that. So had my red light mask for 3 years and love it. I will put on after a shower while I put my body cream on. That's the thing. I literally now put the lip and mouth in and gua sha my face. You think we're that starved for time? I guess we are. But I gua sha while I have my lip and mouth in, which is comment. Do you guys do that? But so how do I get rid of pigmentation? I'm going to keep that question up, but I want to answer about pigmentation, because in my Plasmasomes Derma Roller, which we're creating micro-inflammation, like everything good out there, Ulthera, Thermage, Endolift, you name it, Threads, Sculptra, PDRN, there's micro-inflammation caused that heals. But in my Plasmasomes, I add a couple things, tranexamic acid and niacinamide to brighten. And you're microneedling in, and there's no DNA and RNA. That kit is off the charts amazing for your face and your neck and your body, but most people use your face and neck. It's pointed exosomes. But that, you want to get rid of hyperpigmentation. Of course, you can do lasers, you can do IPL, you can do chemical peels. But if you want to do something at home that does a panacea of issues, then think about Plasmasomes Derma Roller Kit, because I made it for skin brightening. Okay. So I'm concerned about how the red light mask affects the eyes. What effect does red light have on the eyes, even if your eyes are closed? So I made a whole video on it. Look up Rajani red light in eyes. I also talked to one of the top retina guys I'll say in the country, in the USA. That was the second week in January. I don't even know what we're at now. We're second week in February, 15th. And so we talked about red light, and that's a complex question, but there's been no study showing it harms. They're using it in Harvard now. They got the first one 6 months ago to help with macular degeneration. They're using red light. I can do a video on it. You can go look at the exact dose that they're using in their wavelength. And they've used it's been in FDA cleared in their clearance. In Europe, I want to say 4 or 5 years for eye benefits medically. I did a video on it, but I'm not here to tell you shine the red light in your eyes and get rid of your macular degeneration. Obviously, that's a 5-hour video. You need world experts. But I personally, of course, talk to all these guys, have all that information aware, and I use red light and I use red light masks. So watch my complete video because I break it down in depth. Many of you have already watched it. Thank you, Johnny. I've been on hormone replacement therapy 6+ months. It's making a huge difference. So I told you guys about the nurses trial, the health initiative trial for 15 years, because it was come out early 2000s, that was a farce. It's not a farce. You can take data points from it, but you got to be bombastic in social media. You're going to hear that. But that was my 10-minute timer for my red light. It times it for you. You know when to take it out. But back to HRT, we all physicians know, if you've read the trial, that trial took women off of hormone replacement therapy unnecessarily. There's no question that if you have if you're BRCA positive, you guys, if you have it, you know what that means. That's the gene 1 and 2 for breast cancer. You don't want to be on estrogens. If you have an estrogen, there's a couple of receptors we test in breast cancer. It's HER, and estrogen receptors. There's many more now, but those are 2 of the common ones. If you're ER positive, estrogen receptor positive, you don't want to be on oral hormone therapy. There's a big group of people that say, hey, if you put people on estrogen replacement therapy and then you monitor them, it's a way to know if they would have got cancer. You then take them off it, you treat the cancer, and now you know where you wouldn't have known. We're going to be way better than that in the next 2 years with genetic testing. That's a kind of archaic thought, but there's a big group of people who talk about that. Just so you know what goes on at these congresses behind closed doors. So estrogen hormone replacement therapy is huge. It's the future of everything, but how we do it, it's not for everyone. I can go deep dive, but maybe not. I have veneers. It claims tooth whitening, but I don't think it will whiten. But I've hesitated in purchasing because I wasn't sure if it would do any harm. Okay, it's a great question. It claims to do teeth whitening. I don't claim anything on veneers. I claim if you watch what I give you, which is my playlists on everything, it says, go to Dr. Rajani's websites, go to Dr. Rajani's playlist on my channel. I cover veneers. A veneer is this. It's a synthetic. Nothing's going to change the color of this cup from what it is. If there's a stain, you can clean the stain off, but it's going to be white. It's not going to be whiter or less white. You're not going to change the color of a veneer. But I put that in the playlist. So always use my playlist, because what I do, I give you a depth of knowledge, very specific. So I answer 30 questions on the lip and mouth device that you ask me. And as you ask more, I just rip off answers to the questions. So it's all there. But if you have veneers, it's not going to harm them. In fact, when they put veneers in, for a lot of times for the glue to set, they use a wavelength of glue, a wavelength of light to harden the glue. So it's not going to harm veneers. Ultrasound best to tighten neck or radius work best. Don't choose, my friend. This is Zella Malitske. Don't choose. Put it on your radar and put it on your list. But here's how you do that. Let's say money's an issue, like it is for everyone. Look at your neck. Is it fat? Is it hanging down? Do you need surgery to get the snatch you want? If not, or maybe you're happy with a 50%, 30% tightening, like most of us. I just want to look good for my age. I don't need to be snatched up and around. Then look through and go, is ultrasound or radius going to give me my best? Well, ultrasound is going to tighten more. Radius is going to give a nice little bit of volume and then work as a biostimulator. And radius, which I have a little in my jawline here, half a vial, is going to give you that sharp jawline look. And there's a gal pulled me aside yesterday, said, yeah, I did radius. What do you think? I hadn't seen her in a year. What do you think of my jawline? And she put radius through here and she did a little hyperdilute in her neck. And I saw a difference. I saw her a year ago, I remember, and it looks great. She looks a little different than she did a year ago. Better. She did easy PRF and easy gel under her eyes after she saw my lecture last year. She looks phenomenal. And so pick which one you think is going to work best. In general, in terms of those devices, if you're paying $4,000 for the ultrasound, which is what Ulthera might cost you, you're probably going to get more bang for your buck for $2,000 for a couple vials of Radius. But I don't know your neck. You have to determine, is it crepey skin? Is it loose laxity? Do you have platysma banding like this that's hanging down where you need those removed first? Your platysma bands, you can toxin them. But that's where the consult comes in, and you need someone honest. What is Radius? Radius, not the radius of a circle, but RADIESSE. It's calcium hydroxylapatite filler. 70% of the syringe is carboxymethylcellulose, which is in your shampoos and your toothpaste, a non-injectable form. And 30% of your Radius syringe is calcium hydroxylapatite. So it has the highest G prime of any of the fillers in the world because it's calcium. It's hard. That's what Radius is, but it also can be diluted and used as a biostimulator like Sculptra. So how often should you do microneedling? Amazing question. With plasmasomes, remember, I wish I had the kit here. Maybe my team has a picture show you what plasmasomes look like. It has a stainless steel, look how good that team is. Amazing. Stainless steel roller, which is what you want. The perfect depth of 0.25, and that's how plasmasomes should be used. If you have a 0.5 at home, stainless steel, you could use that. You don't need to go deeper because it's for absorption. It's not, we don't need to go deep. It's not acne scarring roller. And plasmasomes are 7 synthetic exosomes, meaning they don't come from humans. There's no DNA and RNA, and they're specific pointed signals to your skin. Next level stuff. You put the plasmasomes on your skin. I made a really nice roller to put them on, and then you derma roll, and then you can put the plasmasomes on after. Lip lines, neck crepiness, jawline, under eyes, forehead. I use it everywhere. And that's part of your glass skin. We had a long conversation in the lectures here in Miami yesterday about glass skin, and I polled the audience. 90% of the people in my room had patients walking in, they're all aesthetic physicians, plastic surgeons, dermatologists, asking for glass, clear skin. So you know the trends I'm talking about, 90% of them. And people wanted to come into clinics every month or two. My goal for you is to do as much at home as you can. How often should you do it? It's pro healing. So if you're derma rolling a peel in, that's not pro healing. If you're derma rolling a inflammatory product in, like hyaluronic acid that you got a bottle of in your room, that's for your external skin, that's not pro healing. But plasmasomes you can do every 7 to 10 days because it's pro healing skin exosomes, synthetic exosomes, growth factors that signal to heal. Because why your neck is aging is because of the microbiome and the inflammation that this thin skin is seeing. My cheek skin is thick. It can see and tolerate way more than this skin here. I have to treat this skin different than this skin, as you might imagine. It's why the derma roller that comes with plasmasomes only needs to be 0.25. It's great for the laxity on the neck. If you don't want to use light around your neck, which I do, I have no problem with red light around the thyroid, but some of you do, go to the derma roller with plasmasomes. So pro healing, you can microneedle every 7 to 10 days, no problem, because it's not increasing inflammation, it's decreasing. So that gives you an idea for the derma roller. You can obviously, I'd say one of the creams free, you get a free Nectafirm. Let's put that number up again. Maybe you guys haven't, I didn't notice it because I've been yapping to everybody, but let's put the number up of how you get the specials. But you'll see Nectafirm, you get a free one when you spend over $250 on anything today. But Nectafirm, which is from Revision, pays attention to the neck microbiome, but it also has something in it called MCTA, which is a derivative of theophylline, and it sculpts your neck. So if you can, there's the text line there, but remember, you guys on the back end, they can text the number all they want, but remember, what do they got to text them? Live. So throw that up there at the same time. I want to make sure, text live. Okay, so what you're going to do is put in your phone 5412877384, and you want to in your text, you want to put live, Live, and then you're going to get a code for the specials to use. So I texted and didn't receive the code. So that's from D Rocket. Okay, let's see what happens. You could try again. We do have customer service. They're off the charts, amazing. They work 7 days a week, and then do use the entire. So you guys, they'll check on the back end to make sure that you get it. But anyone who's texted that and it worked, comment in the comment section. Let me know that that's working. I included live and didn't get the code. So D Rocket, that's still one person. Let's see if anyone worked. You guys can let me know if it's working. 541-287-7384 and use the word live, and it'll text you back how you get it. D Rocket, thank you. So maybe you did it wrong. It worked. Okay, she got it. So and there, the banner at the bottom has it too. There you go. So Nectifirm has that MCTA in it. Okay, and why I've been big on Nectifirm, as you know, I don't have a lot of products from other people in our store, is because it kind of sculpts the neck. Okay, so that MCTA, it sculpts the neck. They also pay attention to the microbiome, and there's peptides. So it's a very different formula from anything that you'll use along the neck. And yeah, okay, Anna Wheeler, thank you. It's working. Exobalm is pro healing as well. I talked to that company yesterday here in Miami. We had a good long talk about that. And they wanted to know if you wanted more Korean stuff. So you guys let me know. Yeah, so it's working. So you get free Nectifirm when you spend over $250. Look at this before and after. Yep, I like that you guys put that up, put that back. So when you look at the neck, the jowl is improved, of course, but it's that loose neck skin. Okay, and that's after using 7 weeks of Nectifirm. So again, here's another one. So it kind of sculpts the neck. It helps with crepey skin. There's something about everyone who's using Nectifirm. Thank you guys. It's all, the code's working perfect. People who use Nectifirm, go look at my Nectifirm videos. It just works. It's a combination that works. So it's a group of peptides, MCTA, antioxidants. There's also THD ascorbate. So for those of you who love that form of vitamin C, it's lipid soluble. Nowhere is that more important than the neck to get absorption of vitamin C. Vitamin C does work in the neck. So that's Nectifirm. And but you get it free over $250. So there you go. What about Sculptra versus filler for the jawline? I like that question. Let's answer that. I talked to everyone from Sculptra, from the company yesterday. We had a long conversation about where Sculptra goes. Remember, this is the stuff I'm bringing to you. I'm sitting here. There's a nice, beautiful golf course out there right in front of me. I'm not playing golf. I'm going down to talk to everyone down there. We should do a live someday from the exhibit hall. I think you guys would like that. I try and do it off my phone, but I'm not that. The phone's pretty restrictive, but I can take you through it on a live sometime, which we did in Korea, if you remember. But so yes, Sculptra is shown to build collagen, although people say scar tissue. Every plastic surgeon down there yesterday uses Sculptra in their practice. I'm kind of going through the Rolodex in my head, but you'll get 5 or 10 online who say it's terrible, causes scar tissue. And then those guys will say they're just babies. Spend an extra 20 minutes. Yeah, there's some fibrous tissue to go through, but so is there when you do a facelift. You don't think there's tons of scar tissue to go through on the next facelift? Scar tissue, the most scar tissue you'll ever get in your face is from a facelift. So tons of people. There was a guy down there yesterday had 30 vials of Sculptra over the course of 10 or 15 years and had an endoscopic full facelift. No problem. No problem. So there's a lot of fear out there, but Sculptra will tighten the build collagen. Filler's going to volumize. Filler's now more used as a pointed product. And they can be used together. I think Sculptra and filler, but I think Sculptra and PRF is still a better combination. Sculptra versus Voluma. Okay, great question. Voluma's Vycross technology. I had a little bit of Voluma up under my eyes when it first came out. I'm going to say that was 2012. I was involved in that launch, Voluma Cheeks. It was one of the first ones. There's 120 of us invited down for that launch, and I was one. I like Voluma. Some people will get a little reaction to the Vycross technology, but more so in something called Volbella. I like Voluma better than Volbella. I like Voluma. Private notes, text not working. Try again. What country you're in? I'm not sure if it should work from all countries. 541-287-7384. Text live, Live. And what about filler for the lips? We had a good conversation on this yesterday. Filler is still going to add the predictable volume. Most people don't want filler to migrate, so they're using way less filler in the lips. They combine it with PRF as a biostimulator, we'll call it. No Sculptra, no Radius, no Bellafill ever in the lips. No Sculptra, no Radius, no Bellafill ever in your lips. Hyaluronic acid is the only filler we use. And then add PRF. And then things like my lip enhancer, 10% off today. Buy a few of them, get a free Nectafirm. Lip enhancer has retinols, peptides. So you have to take care of the lips. You think, if you look at red light and lips and lip volume, people on here are already using my red light. They'll say, my lips look gorgeous. They're red. I'm getting a little bit of volume, as well as gum health, oral health, and rejuvenation. Why do the lips cave in? Men and women. You go look. I was down by the golf course taking a video yesterday. Guy came over to talk to me. 57. He had no lips left almost. Good looking guy. Skin looked pretty good. But he could have got lip rejuvenation, would really help that guy. He wouldn't need necessarily filler. I'd start him off with red light. Start him off with a lip enhancer with peptides. And retinol. Retinol does well, thickens the dermis. And then go to lip filler after PRF. If you don't want to do PRF, you can do a little lip filler. But keep in mind, least invasive first. But for that guy, and especially for a guy, you just want some lip, don't go so invasive right off the bat. I don't think any skin doctor has come out with an app like that. An app. I don't know what that was. Will I get bone loss from doing Botox? So let me give you that answer on April 1. Not that it's Fool's Day. The doctor I work with, who's the expert at UCLA in muscle movement on bone and what it does to the bony remodeling, and I talk to him every year in LA in March. I'm going to go down. I'll be talking to him March 18th. So by April 1, let me give you the updated information. He's done some papers. He's published papers. And I'm developing something right now for your muscles in your face. But I think we're 6 months out from that. But I'm meeting with him with regards to that. As of right now, what I'll tell you is, if you lose, we know this is just factual. If you break an arm and you can't move your muscles, the tendons don't move on your bones, you lose bone mass. You stop walking, you lose bone mass. You're not seeing resistance. That's why vibration works and vibration plates. And he'll pipe in on the vibration too. But he showed some good work that if you stop muscle pull on bones, you're going to lose some bone and you're going to remodel the bone. So everything points to, just don't over Botox. That's the thing. I get Botox maybe once a year. Something's really bothering me. And most commonly it's my frown that I can't get with other things. So glad I found you, Dr. Johnny. Thank you for your content. I have a lot of your products, getting a few more. Excellent. Thank you so much. Yeah, and it's a journey. Of course, sleep, eating real food, and exercise are your top 3. Tomorrow I plan to go to the gym because I have an easier day. I haven't been to the gym in 3 days, but exercise is probably the number one thing that I think I do, along with all the other treatments. But without those other 3, it's tough, even if you have a facelift. Before you get a facelift nowadays, your doctor's going to have you, he's going to spiff you up, or she is going to spiff you up for 6 to 8 weeks before the surgery, because they know the facelift doesn't work if you don't have your house in order. Your house is your body. Do you want to do an engagement, you guys on the team on the back end? Do you want to show some products? I know we have a giveaway coming up. It looks like the text code is working. We'll direct you guys can direct me in the way. I see a bunch of good questions in these videos. By the way, I'm obviously happy to spend this time with you guys. You guys are, our channel is like a family. It's becoming smaller in a sense, but it's more closer, and I like that. I don't need to have the whole world in our crew here. But hit the like button if you like these videos. Underneath the video, hitting the like button tells me, and the algorithm, of course, that you like it, but it tells me that this is worthwhile for you guys, because we're not getting 10,000 people on these live streams. We're getting 1,000 or 2. And then usually 10 or 20,000 watch it over the next 2 days. We want to grow that. We want to have a good community, but we want to have the right people here. We don't need everyone. Not everyone likes this kind of stuff. What ages skin faster after 30? Here's a little quiz. Do you guys like my quizzes every day? On our community channel, I have fun doing them. But what ages faster after 30? A, sun exposure. B, dehydration. C, sugar and glycation. Or D, stress and cortisol. Now, a couple of things I always look in a question, because in medical school, it's multiple choice. People who are good at multiple choice but had no idea of the answer, they often get the answer. And so sun exposure after 30, that's a clue here. Sun exposure, dehydration. Well, as I'm going through the question myself, if I'm thinking fast, dehydration will make you age in 6 to 8 hours. Sugar and glycation, that will age you, but is it fast? Usually over time. Stress and cortisol spikes really high quickly when you're under stress. When you wake up in the morning, you drink your coffee right away. In the morning, you get that cortisol spike. But does it age you fast? Does it age your skin fast or slowly? So that's what I think about when I answer the question. What's the trick in the question? Sugar and glycation. Okay. So wait, B and C. Okay, so dehydration is, of course, going to be the quickest one, but dehydration is the most underestimated. So I didn't know the answer to this question, guys, but like I said, dehydration would be your quickest. Stress and cortisol is important, but it's not going to age you quickly. It ages you over months and years. If your skin feels oily, you can't be dehydrated. True or false? If your skin feels oily, you can't be. I know the answer to this one. I haven't been given the answers. I don't want to give it out to you. They'll give it to us. Give everyone a couple minutes on this. But let's before you guys give the answer, or I guess, did you give the answer here? Are you giving the answer? No. The way it looks like they've given you the answer. If your skin feels oily, you can't be dehydrated. I would not have the question and the X there if I was putting this up myself. But oily skin does age better. So if you see, so some people say, well, men age better because they have oilier skin. What creates oil? I think false. Yeah. I don't know. Do you guys, when I look at this question, I think it's like they've check marked the truths if it's true. The correct answer is false. That's correct. When we go through and you guys make these up questions in the next time, don't put an X and a check mark by them because it looks like you've given the answer. But I don't want to ask this question yet. I want to go back to oily skin because it is true. Oily skin does seem to age better. The skin dermis is thicker, but you don't want to have acne because of your oily skin. And I always give this message in every live stream. Don't let your kids get scarring acne, please, because scars will. I see these hockey players, these kids, they're such great. You're watching the Olympics now, and they're 20 years old now. They're out there with bad acne playing hockey. I know it. You got the mask on, you're playing hockey. The kids are more worried about scoring goals in their face, but they're going to have that acne scarring the rest of their life. Don't let your kids get scarring cystic acne. Do something about it. The very minimal, you got blue light in a mask. Very inexpensive thing to do to help with acne. But oily skin, and of course, a lot of women at this Congress here in Miami, if I ask the 30 to 40-year-old women here, and this is a very open place, people tell you what they do. It's not like they're hiding stuff. They're on testosterone, and they use pellets. Pellets are a little bit of a problem because you can't adjust them that quick. They're in your body, and you get them redone every 3 to 6 months. So you can't adjust the dose like a cream. But testosterone makes your skin a little oilier. So it's one of the things people say, well, women sometimes relatively to other more hormones, relatively have higher testosterone, but men absolutely have an absolute higher testosterone, oilier skin, thicker dermis. So there's a balance there, but your red light mask comes in if you're getting a oilier skin phase because of your hormone replacement or just because of your hormones. So oily skin, very interesting study. Thank you, Abby. Great live stream. You're an esthetician, laser specialist. Love to have laser specialists on here. You guys truly have a skill set. Amazing. Good for you. Lasers are amazing. I didn't know if the team want to ask it. Does Botox lip lines change? Before I answer this, I want to go into so people know what the specials are. A lot of you looks like have just joined. We have a giveaway coming up here in a little bit, but If you text to the number 541-287-7384 and text the word live, we're going to send you our specials. But everything's 10% off. And we have our packages, which are lower face based. So your Nectifirm is your neck and your jawline. The lip and mouth device, which is for your gum rejuvenation, your lips themselves. You can't have a young lower face or a youthful lower face with older lips. Just never happens. And teeth whitening. So you can have everything. I saw someone yesterday with beautiful lower lips, everything, jawline. And I was wondering, like, you think in your head, you wonder why she didn't do something with Invisalign, with teeth whitening. The lips are incongruent with the rest of her face. So it's something people think about now. You can't have a rejuvenated, youthful lower face, spend a lot of money on it, and have the teeth that don't go with it. So it's all together. So that's a special. And then our giveaway, do you want to put up what our giveaway is going to be? And then, of course, you get $250. If you spend $250 or more, you get a free Nectifirm product, free. So Nectifirm, we went through that product in the live stream. The giveaway is a over $1,000 value, which is the lip and mouth device, the Nectifirm. We threw in, don't forget Reebok's Line Relaxer. If you're not on, you have that product, it's amazing. And Plasmasomes, next level. Not enough people in the world know about Plasmasomes. I should get on that because it is next level. And so that's the giveaway. And then you can comment down in the notes below at what time. It's 10:16. 10:16 West Coast. I'm on the, what is it, 1:16 for me? And let me know what time we want to do the giveaway. But that's going to be a different text code for you guys. So the lower face aging, as you see, it's a panacea of just about everything. But we put the packages together because I know, and from this conference, that the lower face, we've done such a good job, I think, in the industry of under eyes, of foreheads, periocular region, even the jawline, that the lower face right here has been an issue for people getting the results they want. Batgirl 6399 giveaway now. They want the giveaway. 1017. So for my team there, you can let me know in the notes when you want to do that so we can queue everyone up. So let's put something of engagement up until you guys get that going for everything for the giveaway. But if you're seeing some results with red light, because people in the beginning were like, well, how do I combine treatments? Starting with your red light, adding your NUA. You're going to do your red light first, your NUA after. If you're using, as a rule of thumb, your microneedling, your dermarolling or plasmasomes, that's always going to be your last step because you're creating microchannels in the skin. You don't want to do your dermarolling and then do your gua sha scraping, or you could potentially do red light after the microneedling, but it's best before. Whenever you put holes in your face, that's typically your last step, other than like what we do in clinic. Once we put holes in the face, either RF microneedling or we do just regular microneedling. Anything, if you're doing Ellacor, all those holes in the face, we do put PRF on top, or exosomes or salmon sperm DNA type facial stuff on top of openings. But anything with gua sha or your red light is going to be before your microneedling. So I hope that helps with layering. How many steps in your skincare routine? This is important. Obviously, in Asia, it's 5 to 7 steps plus. I'll be in Korea in a couple of weeks here. I'll tell you again what it is. But 1 to 3, 4 to 6, 7 to 10, or 10 plus. Yeah, you might need an intervention. 10 plus is common now. We're getting ready for the Valentine's party last night. People were texting each other on the group. There's way more women here, of course, as you might imagine, providers than men. When you going? When you going? When you going? The women take about an hour to get ready to go down there. I put this shirt on, we're down there, right? So I can do several steps. But when you add makeup to your steps, then a lot of people want Korean sheet masks on for 20, 30 minutes before they apply their makeup to make the makeup perfectly smooth. Korean sheet masks are used a lot of times before makeup. So because it gives that pre-filter look. So what do you guys say? C, A, I think we'll pull these up and give you the answer, but a lot of D, someone's D, C, 7 to 10. That's very normal in America now, is 7 to 10 steps. I'm committed. B, Vivian, you're good. B, C. Yeah, I'd say between B and C, but C, if I had to ask this 3 years ago, you guys would have been at 1 to 3. 10, 12 years ago, 1 to 3 steps. Very common now to have 7 to 10 steps. Korea 7 to 10 and then 10 plus on Saturdays. Very interesting over there. When I poll people, a lot of the gals who I work with at the companies like the Korean sheet masks, the Korean skincare companies, when we're in a boardroom meeting, Saturdays is like a day of skincare. They're masks. They're at home. They're at home salmon sperm facials. They're at home LEDs. A lot of things are going into their clinic for are their hyperbaric oxygen, things that they can't get at home. And a lot of the rich have hyperbaric oxygen at home now. It's becoming more available, but it's huge. So let's do you guys want to do the giveaway? Perfect. So this is what it is. You're going to text 541-287-7384, but this time give, GIV. And then you're going to be given the links to enter the giveaway. I love doing giveaways. Happy to give a bunch of stuff away. It's fun. You guys are a great community. But this is the data that you wanted. Text 541-287-7384. I'm going to stay and answer Q&As for you. You have until midnight tonight, so you don't have to rush off of here and go do this. And it's not first come has a better chance. So there's no rush. Take your time. If you have friends who aren't on this channel or don't follow, it's a very nice way to say, hey, join Dr. Rajani, as opposed to saying, you know what, you look 10 years older than you should. Get on Dr. Rajani's YouTube channel. That goes over good at conferences like where I'm at today in Miami. We say that to each other. I mean, people haven't seen you. They look at your face and say, oh, you're not looking good. You're looking good. It's how it goes here. But for most people, giving them an opportunity, and maybe if they win, they'll share it with you. I don't know. But this is something nice to share with your friends who aren't a part of our community. Just make sure they're great people. We don't need everyone on this community. We want a great group of people. Here's what you're doing: morning cleanse, toner, mist, serum, eye cream, moisturizer, oil, sunscreen. Very easy to get the 7 steps back, girl. Yes. So, and we'll keep that up. So the number now below me, you're going to get the giveaway information, 541-287-7384, and give. I'm repeating it in case some people can't see, but they can hear. 541-287-7384, and the word give is what you're going to text. So the reason that we did a giveaway like this is so that you also understand that the lower face aging is not one thing. It's combining all of these things. Maybe in the comments, because I know a lot of people want to have the giveaway, a lot of people want to know about the 10% too, but that is the same number, I think, is what it was with Live, L-I-V-E. I believe it looks like it was the same phone number, but Live, L-I-V-E. And then, of course, the $250 more, then you get Nectafirm for free. So I'm excited for all of you with the giveaway that you can have. So thoughts on Fotona 4D. A lot of people ask me, Fotona is here at this conference downstairs for laser lifting. Fotona is a laser, and there's no new wavelength that's proprietary out there. Some people say it's a cool wavelength, meaning the wavelength is made through cool technology, so cooling of the diodes. But it's more important who's using that laser. There's no proprietary wavelength. 1064s are common use for laser lifting. And in the lip and mouth device, of course, we have different wavelengths that I talked to you about. Let me see, I had 1072 is what you're going to know from the lip and mouth. But 1064 is going to be in your laser lifting. You're going to know EndoLift from laser lifting as well. That's where I did a video on. You put the wire down, and that's a laser that goes underneath the skin. So there's all kinds of lasers and wavelengths for lifting. You guys will know Fraxel, 1550 nanometers and 1924. 1964 is your Fraxels. So they would be laser lifting, but also browns. So you see it gets complex. So don't focus on the laser. You can ask about the wavelength. There's going to be 20 lasers at that wavelength, but how are they using it? What's the duration of the pulse and how are they using it? How many have they done? You want them to have done at least 100. You don't want to be in the first 20 or 30. Let's see. You want to put up a couple questions here? Yeah, you guys enjoy. Yeah, no problem. I like doing these lives for you guys. We're going to do more. There's a big hype about Zerf and social media. Yeah, Vivian, for sure. Vivian, you're on social media, so you know. The next one coming that's not Zerf is going to be, it's Korean. I think it's going to blow your minds. And I think that I don't want to say too much. Probably can't say too much. There's one coming. I'm going to keep you posted. Maybe you keep your money in your pocket. And it's very similar in mechanism of action. It's from Korea. It's there now, but you guys are going to have access to it soon. And there's going to be a fair amount of devices. And I'm going to figure out how to find a way to direct you to different practices if I can. I make no money off that, but I know the next question is going to be, well, okay, you like that device? Where do I get it? I'm going to try and have it all together for you, but it's coming. But yes, Zerf, there is a lot of hype. My video demonstrates it very pointedly and correctly. Everything in my video about Zerf is the correct information. So if you see TikTok hype, just go to my video. Ultra clear laser, I love it. Ultra clear user QD1U is asking about it. Ultra clear also has a laser micro coring setting or handpiece that is like, you guys know Ellacor, which is physical coring, physical pieces of skin that comes out of your body. Ultra clear has a laser mechanism of that I quite like. So ultra clear, yeah. And then they have a handpiece for browns. So it's all PDRN, my steps. Yeah, Vicky likes PDRN. PDRN is the building blocks of RNA and DNA, like cytosine, uracil, guanine, adenine, those building blocks that come from salmon sperm, concentrated to help rev up your own RNA and DNA to make better skin. That's what salmon sperm really is. Zerf and what's coming versus Sculptra. Well, Sculptra is an injectable. Zerf is a radio frequency device with 2 wavelengths that has a cooling cryo handpiece that's similar to Thermage, but less pain. And they have this proprietary cooling, but it's radio frequency skin tightening to denature your proteins and contract the skin. I think the one that's coming next is going to be quite amazing. And I'm going to fill you in on that. I'm going to be in Korea, and we have a lot of patients lined up. It's been around for a while in Korea, but I'll get you all the data on that. And when I tell you about it, you'll be able to, I think, go get it because there'll be enough devices in America that you'll have access. That's what I can tell you. Home lasers, it's a tough game. Home lasers, they'll often model themselves of low energy type of original Fraxels. So around 15 nanometers. Depends on what you're trying to do. For brown spots, which is what lasers are great for, sunspots and sun damage, you might go to chemical peels and tranexamic acid that's in my plasmasomes. You can go to home peels. Combination peels are going to be best if you're doing them at home, but to be honest, you can get a great peel done in a med spa for probably $250 to $500 that has TCA, retinol, vitamin C, and even more. So you might find an AHA in there, but phenol. So phenol, you guys are going to know the deep phenol peels. People look crazy because they're high concentration. You need anesthesia, but a micro dosing of phenol. So phenol can be in your home peels, but particularly low-level combination in med spa peels, probably going to be better off than your home laser per se, because home lasers aren't going to really tighten your skin much. Yeah, Marlene Harden, 544, love the TCA peel. TCA is great. Targets your sun. You got to stay low. So start at 5-10%, 3-4. Start low. Don't go up to a 20%. Put it that way. Depending on your skin color is going to depend. But if you're doing these at home, start low. I think VI peel, for instance, is 3% with retinol, with vitamin C in there. So do peels get rid of sunspots? Exactly. That's what they do best. Do you refrigerate microneedling plasma? You don't have to at all. They're stable. They've tested stable at room temperature. If you want to refrigerate those things, you can. Same with your skincare. No, stay at 15 only. Skin tightening after weight loss of 21. What you're going to see, and a common theme at this Congress I'm at right now, is everyone's talking about the companies. You guys hear a lot of sirens in the background. This is my mic here. I'm in Miami, so there's sirens everywhere. Hopefully it's not distracting. But chin filler is great. Saw a gal yesterday. She said, I didn't have a chin when I saw you last year. Look now. Looked amazing on her. Chin fillers are big. God, where was that? I was going to ask the weight loss. So GLP-1s, all these companies are targeting the story off the GLP-1s. I have not seen anything in my life. You can't watch a soccer game, a hockey game, figure skating. You don't see anything without an Ozempic commercial. To be honest, it scares me. I think they're great products. If I had told you 10 years ago that you're going to be able to inject something into your body and go from 400-pound person to a 150-pound person, you'd have said, Rajani, you're nuts. As nuts as the nut mix. It's $80 in this hotel. The nut mix is $20 back there. You'd say I'm nuts. But you can inject now GLP-1s, Ozempic, Wegovy, whatever flavor you want, into your stomach and lose 300 pounds. You had to have bariatric surgery to do that before. Now you inject a little piece. What you see is going to blow your mind. But all the companies know that. And there's something called Ozempic mouth, of course, because the mouth is drier because it's a hormone. So there are side effects to everything, such as stasis of your gut. I saw someone yesterday, 44-year-old, people come up and tell me everything. I love these conferences. She said, yeah, of all things, I had an intussusception. So that's where a piece of the bowel moves into the other bowel. I think she had surgery sometimes kids get it, the ileocecal junction. But I think she had surgery to remove it. But she was sick for 6 months because she was on that, had a bowel intussusception. You'll see that commonly. There's cases of blindness. It's rare at GLP-1s, but side effects of dry mouth. So teeth rot, less teeth whitening, gum disease, gingivitis, bone loss around. So companies, all the laser companies know this, and every one of them is going to have a GLP-1 play. So Sculptra is going to add your volume. Lasers and peels are for your browns. They work together. That's the short answer. That's the long answer to a short question. Now remember, for the giveaway, text GIV. There's no rush. It goes up to midnight tonight. But can I use the NUA device if I have my melasma? Any heat, melasma is a bugger. We talked about it yesterday. PRF and PRP, by the way, there's studies on PRP to reduce melasma. It's why PRF microneedling, people's skin is clearer, which is why you can't get PRF at home, but you can get plasmasomes. And it's why I added tranexamic acid and niacinamide to the pointed signals for your skin for elastin and collagen, because I know you want clear skin too. And it's all in that one kit, plasmasomes. NUA device, however, is heat. So if heat makes your melasma worse, sun might make it worse through UV, separate from heat. But if heat makes your melasma worse, you want to avoid heat. RF, ultrasound, thermage, those are all heat mechanisms. You want to avoid them. So if you have melasma and it's hormone dependent, pregnancy sometimes gives the mustache of pregnancy. That's a hormone related melasma. But if hormones make your melasma worse and you go on hormone replacement therapy or the birth control pill, you might get melasma worse. Yes, tranexamic acid orally and topically, which topical in my plasmasomes, is amazing for melasma. So you probably want to avoid NUA if you have melasma, if it's heat sensitive. Chin fillers, I already answered that. That's great. Code is working. Thank you, Pat Candy 1. I did home TSA and burned an area on my nostrils. It's still like a burn. It's no joke. If you don't want to do home peels, don't do them. There's experts for a reason. And it's why I haven't gotten behind any one home peel for you yet. I haven't had time to make my own. But the ones you get online might not be perfect concentrations. And people think if good is okay, a lot is better. That's not true. Same with Botox, same with filler, same with Sculptra, Bellafill, whatever. Red light's nice because your cells only take the red light that they need. So there's no overdose of red light per se. It's just that it won't work. If you do the red light mask 3 times a day, the main benefit you're getting is from the 1.5 times a day versus the other 1.5, meaning as you use it more and more, you get less and less benefit. The cells take what they need of the red light, which is why that's what makes red light so common, is the safety factor. So that gives you information that TikTok won't let me follow you because you've reached your limit. See, I don't know. I mean, those guys, Larry Ellison, those guys are changing the TikTok algorithm. How do you get a limit? So maybe my team will look into that. Haven't spent a lot of time on TikTok trying to get that thing going, because it seems like we got such a great group of people on YouTube here. And let's see, what do we got here? Is Sculptra safe for those with autoimmune diseases? I go for, if I had an autoimmune disease, obviously there's autoimmune disease down here, low level, and there's autoimmune disease up here that's intense. It always poses a risk when you put a biostimulator in your body and you have any autoimmune propensity. But PRF is your own stuff. So if I'm an autoimmune person, I'm going to PRF first. We had a great conversation about this at the Congress yesterday in my class. So I would go to PRF first for sure. And then I test people sometimes wherever you want, behind the ear and the forearm for Sculptra, make sure they don't react. But there's no dissolving Sculptra. So start slow and work up. But it's a loaded question because I don't know you got to take a medical history from someone with that. But yes, it's a great question because Sculptra, people love Sculptra. It's good. I've been on hormone replacement. I've read hormone replacement therapy recipients shouldn't have injectable tranexamic acid due to possible stroke, heart attack. Is topical safe for HRT? Always follow your doctor's recommendations on that. Remember, with a 0.25, it's very superficial. Okay, so it's skin dosing. It's not injectable. Can't get the TikTok. My team will check out what you're talking. Can't get the TikTok entry to work. You shouldn't need anything with TikTok to enter. You're going to text 541-287-7384 and put live for the code for your 10% off everything I have, and for the giveaway GIVE. And even if you think you might win, you want to take advantage of the sale. And if you win, great. We'll take care of that. But I want you to make sure you get the store-wide. And I want Nectafirm. I don't know that we have that many to give away. But when we give them away, we give them away. But there's in the hundreds, but not, we might run out of the Nectafirm. Just know, I did one of these before. You guys know I ran out of the Plasma Restore Glow gummies. That was a tough time because it was hard to get them. So if you think you want the Nectafirm with the free Nectafirm with 250, then you should do that. Don't count on winning. If you win, we'll take care of things. So is microneedling okay for someone with blood thinners? Microneedling with 0.25, yeah. If you start to go to 1 millimeter, 1.5, you might get more bruising. Again, blood thinners, you could be Coumadin, you could be on injectable blood thinners at home, you could be on heparin. There's different blood thinners. Anytime you have a medical problem, ask your doctor. But aspirin's a blood thinner and fish oil is a blood thinner. Megan, love your videos. Thank you for that. I hope you appreciate them. I'm up at the Congress. At some point, I'm going to go down there so I get more information for you guys for a next live stream. What great deals. I was able to get a couple of things for my wish list. So welcome, Jack's Place. My goal is to make all this stuff available to you as inexpensively as possible. It's part of my trip to Asia coming up now, is to make sure we get you quality at the lowest price of all the things that work and develop new stuff. But the stuff we have, like the lip and mouth, in my opinion, next level stuff. So teeth whitening, red light for gums and gum health and rejuvenation, cold sores, which we added on, and then lip and lip rejuvenation in one device. So whenever we're making stuff or I'm developing it, a lot of time and effort goes in to make sure we got the right fluents and the right energies and that it works well. It would be awesome to take a trip to Korea with you. I would love to have firsthand opportunity to learn and experience that. Maybe a group trip. I'd love to do that. It would be amazing. I've done group trips with medical professionals before. We've gone around in Korea. It's super fun. And of course, they all want stuff done to their face over there. So it takes time to go through the clinics. But I do give you videos in those clinics to help give you a flavor of what's there. But it's next level stuff. And yeah, I'll be there in a couple of weeks. We're developing some new products. But when you go down to Gangnam in the Korea area, and I talked with the people here, and they're very kind. I told them I'm going to be there in 2 weeks. They're like, you're not coming. They're going to fly from America over there to see me. They're next level kind. Because they don't want me to be there without them, and they want to put me up here and there. So it's fun for us as a channel. We're going to be able to do more, and I'm going to be able to let you know a lot more of all the goodness there of what you need to know. Like we talked about with the ZERF RF, well, there's the next level RF, so that you take your time and do the right procedures. So all those things you ask me, keep asking questions in the comments of my videos, because then I know it's important to you. And on the live streams, by clicking like, it's huge to me. By sending the link to the giveaway to your friends, it's huge to me. The more we grow here, the more you grow. And we can do trips like that. And we can do discount codes on procedures in clinics. Those are all things that are possible as we grow and become more powerful within the space of the industry. And you guys end up benefit from that. So glad Plasma Glow gummies are back. Thank you. Yesterday, in the session I did, someone got up and said in the session, hey, I had PRF done. Whenever I do it, I start 1 month before my PRF getting Plasma Glow gummies. That's why I developed the gummies. So there's vitamin C in there. There's silica. There's all the elements in there that you need to help rejuvenate skin in one supplement. Plasma Glow gummies. So a lot of the practitioners who do PRF here at the Congress that I'm at, they give the gummies either a week or 3 weeks before the PRF, and notice they get better results. This holistic approach, it's just starting. It's just starting. Much to the chagrin of a lot of companies, because a lot of things that they're doing and selling are going to become obsolete. And there are people here, I don't say this because I don't see it yet, but a lot of people here do think surgeries are going to be obsolete as the 20 and 30-year-olds are doing these treatments. Something else, peptides. You guys all ask about these different peptides. And a friend of mine was giving a lecture on peptides yesterday. He goes, I'm afraid to go in that room because what I'm going to say, they're not going to like. And peptides are great. It's the future. So they're great. It's the future. But what his message was where half or 3/4 of the vendors, I'm going to say med spas, doctors' offices, I'll call that a vendor, are getting their peptides to infuse into your body, I'm talking IV peptides, are not good sources. And that's very scary. So am I walking downstairs? I can get any treatment I want. Am I walking down there getting peptides? The answer is no. Are there some great peptides out there? Amazing. Is it the future? Yes, like exosomes. But that's why I come up with plasmazones, because I didn't like the exosomes on the market as a whole. We tested a lot of exosomes and there were no exosomes in the vial. So there are a few great companies, Benev being one of them. And when I go to Korea, you guys see me at some of those factories. Seborrheic keratosis, you want me to talk about that? I'll make a video. That's a very specific topic. A lot of people here, I'd probably bore them over seborrheic keratosis, but we'll do one on that. For me at 60, I love red light therapy. This is Marie. Zip Halo, great. I had the Zip Halo on the other day. We looked at it. The only one in office treatment was Sculptra. 4 vials last year, get 2 vials this year. Love your gua sha sheet mask. I love everything you're saying. And Zip Halo galvanic. And if you're using NUA, then that would be your next step up from something like Zip Halo in terms of results. But a lot of people like their galvanics because there's little downside. They help with a little bit of muscle stimulation, but they're more for absorption. Again, more on this in the next 6 months from me. So save your ideas on that. But that's a great combination you're at now. A lot of people are going to balk at your 6 vials of Sculptra, but that's very normal. You said 60. I was going to say you didn't say your age. By 60, to do 2 to 3 vials of Sculptra, wait a few months, do another 2-3 vials like you're doing. Very normal, very good, very appropriate dose. You're going to love those results. And if you don't want a facelift at 60, you may never want one, but at least better off getting it 65, 70 than getting 2 or 3 facelifts and they're having to go through scar tissues. Remember, your first facelift lasts you about 7 to 10 years. Your next one's going to last you less for many reasons, but it's more like 4 to 6 years. So in my opinion, still today, if you can hang on the monkey bars and keep avoiding your surgery, the better. And I know the narrative is for younger and younger facelifts, but if you go to congresses like this, people are speaking out against them. And there's people that stand up and say, hey, I had a facelift, had nerve loss. Can't feel my face, can't move part of my face, and they're devastated. It happens. It's a surgery. It's no joke. And you guys tell me in the comments. This is a funny story because I did a video on bone loss the other day and we talked about sardines, but just completed a 5-day sardine fast and my skin feels so good. That's Jennifer, that's true. I 100% believe that. When you don't have EPA and DHA or the omega-3s amongst other things and antioxidants in your skin and you do a fast, you'll see the glow on your skin. It's real stuff. No one's going to do the sardine study. There's just no money in it, but absolutely believe that. I have krill oil. If you like supplements, for me, I can't eat sardines every day I'm on the road. I barely got a breakfast at this hotel. I had eggs Benedict this morning for $60. It was, I'd rather, so I got to take my krill. Krill oil has astaxanthin in it. That's why I like that. Traveling soon, Jack's Place, all my devices going on a carry-on. I make my devices so they go on a carry-on. You guys know I never check luggage in. And they're made so they can go on a carry-on. It's why I made the LED face mask with a detachable battery. You can put the face mask in your checked luggage, and you can put the battery in on your carry-on, and it's not going to take up much room. Same with these, the lip and mouth. Obviously, the battery's in this part, but it's not going to break off. You can put this in your luggage. There's no battery, and the battery's in here. So I make everything travel friendly. Why? Consistency. Okay. So can you do Sculptra and PRF together? It's called Plasma Sculpt. Plasma Sculpt. And I own the trademark on that, but people can do it. They just don't use my name. But PRF, not a lot of people know how to actually do it, but PRF and Sculptra mixed together or in different parts of the face, phenomenal. I'll leave it at that, but unbelievable combination. I've been doing it for over 10 years. Who should we see in Korea? Me. You could see me in Korea. There are people in my videos, sometimes I highlight. What I would wait for is wait for 2 weeks. I'm going to go to Korea and we're going to film some treatments and I'm going to tell you about the new product that's coming here. I just not probably allowed to tell you about it now, but I've been waiting for this device to get over here and it is confirmed. And I'll be in a bunch of doctors' offices there, so we'll see. What's the most effective for lower face sagging? Gua Sha with Hydroglow or microneedling with plasmasomes? I need a coffee sip here, you guys. I haven't had a real cup of coffee in, it seems like, weeks. The guy brought me this to the hotel, a flask of coffee. It's okay, actually not bad. Don't try not to decide. Pick one. Pick your Gua Sha is easy. It's inexpensive. You're going to get addicted to it. Just drop my mask. I'm going to put this mask on before I go down and see everyone here at the show today. And then I'm going to Gua Sha. But it's so easy, so quick. You can sit here and you can do it. You can talk to your friend and do it. It helps. This is built for your bony sides, your brow lift. I mean, I'd say Gua Sha. This is the one I leave. And if I don't bring it with me, and also it releases facial tension. So it does a lot. And you've got red light in it. So if you can't afford a red light mask, you got 830 and 630 nanometers here, and you got vibration in it. So you got so much in one inexpensive device. Remember the Hydroglow oil that comes with it. You guys developed that. I formulated it. We added the different oils that you guys told me. So that's what's in there. So I go with that first. Plasmasomes and microneedling, it complements it. Which one, if you can do both, you do both. Everything's 10% off now. And then you can purchase it and put your name in for the win. You might get plasmasomes. So they work together. And it depends. If you're 20 or 30 or 40, you're young, you have choices. As you go to 50, 60, 70, just like with life, your choices are going to narrow. You need both. You can't just do one. So you can, but to get the result as we get, your morning routine at 60, at 30, I just got up and cruised out the door. Now, I need to take a couple things with me, um, eye drops. You're out there, well, that air conditioning, you might need eye drops. I take glasses just in case I go outside. I don't like the brightness. I didn't mind that at 30. I do now, older. Love the gummies. Thank you. Yeah, I want to minimize things for you. Obviously, there's 8 steps. I want every step to be important, but the gummies have everything you need in them. And for those just joining for the giveaway, remember the text line for the giveaway is 541-287-7384. Text the words give. That same number, if you want the 10% off, it's LIVE, L-I-V-E. Maybe my team will put that up for me now. It's scrolling on the bottom there. Scrolling on the bottom is live for the specials and the package of specials. I put packages together for you that you'll get access to. Caroline, where are you that it's evening? In Miami, what time is it? It's 11 plus 3, coming on to 2 o'clock, I guess. But 10:50 a.m. LA time, I know that. Should I start with your devices before toxins? So I guess, Julie, what you're saying, you've never had toxin before, but you want to start it. Your Botox, Dysport, Latibo, Xeomin, those are toxins. They bind the receptors within 2 hours. So you don't have, within 4 hours. So you can avoid using devices for 24 hours if you want to be super safe. But you can use devices the day before your toxin you get in your face, your Botox. We call it Botox just to stay easy. Or you can use it 24 hours after, but they work together. So, but if you're thinking, why put a toxin in your body if you don't have to? If you're thinking that the devices by far are going to do way more, in my opinion, this is going to do more than a toxin. A toxin's $200 for the frown, one and done. A gua sha you have for life. That's your whole face, neck, and body. So it's up to you to decide what you want to do, but that's how I do that. What's the latest with peptide injections? For my money and my bang for the buck, unless you're sick or ill, or you really have something that you need a peptide for, I'm not throwing peptides in my body, but I'm not using Ozempic in my body unless I need to. I have a lot of gal friends here. They're slight. They're 140 pounds, 150 pounds, and they're 5'6", and they're on Ozempic. That wouldn't be my course of action personally. I'm not putting a hormone in my body that can affect my eyes, my mouth, my gut, so I can lose a few pounds. I'm getting my rear end to the gym, and I'm changing my diet, and I'm sleeping better before I go on GLP-1. People do want the shortcut. I guess I'm a little more holistic than that. I love the drugs. I think they're going to save a lot of people. They help those with insulin sensitivity. So I'm not against it at all, but we're early, you guys. We're early. Do I do hormone replacement therapy or topical estrogen or topical testosterone? Very, very different. So you can't compare. Oral hormones are going to affect your whole body, your brain, your organs. Topical estrogen, for the most part, doesn't really absorb. That's controversial. Some people get a little breast tenderness when you go on estrogen cream for the face, vaginal estrogen cream they put on their face. They'll get a little breast tenderness. You should not get changes in your period. If you still have periods, you should not get vaginal bleeding. Some people will describe it, but the majority say they don't get systemic symptoms. That's generally accepted. When you take it by mouth or pellets or patches or creams, you're going to get systemic absorption, and you can do both. So if you're getting oral or pellets, a lot of people still use the creams, but there's less benefit to using the cream. I'm running out of your non-consumable products to buy. Hands, yellow hair, red. Yeah, I can't come up with products I'm not, and people probably seem to get upset. Oh, you're selling something else. We launch about 2 to 3 products a year, and that's a beast. It's a beast to do. I'm running on 8 cylinders. Cars are electric now. I don't know how you measure the megawatt. I'm running on all 8 or 12 cylinders just to do what I'm doing. So I don't have any more energy to develop new, but I'll tell you, we got some new fun things coming that are going to work with our existing devices, not exclusive, but go with consistency. Okay, yeah, I know you guys love new products. People love new. And for me to have a new thing to sell you every week, the most successful influencers in the world aren't those giving you information like I'm giving you. We're the ditch diggers, as I say. We're the hard workers. The easy low-hanging fruit is just me selling you something, 20 new products today, way more money to be made. But I don't, I'm not, that's not my gig. My gig is I want to learn. I want to learn from the best of the world. I want to bring you the best. But yes, if I was just selling products, I'd be just sitting back at this hotel, and then it would be all fun. But I love learning about it and bringing it to you. It's the most exciting time. I'm telling you right now, what you're seeing coming in the next 2 years, if you're doing these things that I'm talking about, you're on the right track. The more holistic that you do it, you're going to see you're going to need to take less risks to get better results. One thing I alluded to that I didn't talk about yet in the stream was things like Renuva is fat from dead people. They check it for viruses, they purify it, they package it, and you can inject it into your face and hands. The majority of people injecting that product, and it was injected here yesterday, live. It's expensive, not all of it takes, and there's something called prions and virions that you got to be worried about. Prions are abnormally unfolding proteins. You'll know of Jakob-Creutzfeldt disease, but there's many others that signal proteins to basically run away in a bad manner, to unfold the way they shouldn't and cause problems with your body, particularly your nervous system. We don't know of all the prions that exist. And virions are complete RNA and DNA viruses. And of course, you screen for HIV, you screen for HSV, herpes simplex virus, and different ones. But what about the 1,000 we don't know of? So I'm not there yet to inject that stuff in my body. There's something called AlloClay out there, and there's a new one coming that's for sculpting the face and body. And those are fat from other people. And there's going to be fully synthetic ones that come along. Are you ready for that? Probably not, when you can take everything out of your own body now, and you can even do fat transfer. Are we going to get there? 100%. It's coming. Are your lip products the only thing ever worked for me and I'm 65? Yeah, great question. I love that. See if I can get your name, give you a little bit of credit. But yeah, Lorraine, all your lip products are the only thing that ever worked for me and I'm 65. Because people often ask me about age. There's 65-year-olds are going to see down here today that literally look 45. You'd never know. And so things work when you're older, especially if you've maintained yourself with your diet, your exercise, and you've turned that around. Go on Ozempic and everything, lose a bunch of weight, you feel better about yourself, get your insulin sorted out and insulin resistance sorted out, and then you now go on the products. They're going to work because your body's amping up its own exosomes, growth factors, mesenchymal stem cells. You're coming back to life. So I'm not worried whether you're 65, 75, or 85. It's about your routines. But Lorraine, you may agree with this, you may not. Your routine at age 65 is way different than 20. Probably didn't think about it. And you look gorgeous, of course, from your picture here. At 20, you probably get up out of bed, did whatever you want. At 65, you now get up. If you're like me and you're like, put 2 feet on the ground, you figure out what injury is harming you today, and you do a little exercise and you get going, put on your skincare products, get your red light on. And so our routines change as we age. It's very normal. Okay, dermatologists recommend using Triluma for melasma. Triluma is hydroquinone, which a lot of you don't like. I like it. Triluma also has a bit of retinol in it, and Triluma also has a steroid in it. I want to be able to use one of your devices, but I don't know which one is the best to help the rest of my skin without worsening melasma. It's a great question. Why didn't you start with plasmasomes? Plasmasomes don't make your melasma worse. There's tranexamic acid in there. It's microneedling with a medical grade stainless steel derma roller. It's on sale. There's no heat or light that might get your melasma. And if you do go to red light, choose my Halo mask, where you can turn off the near infrared. And you can use just red light to start, add near infrared, and watch and see if it affects your melasma. Less than 1% of people will. You'll probably be fine. And then you can add PEMF. I built it so you can add up. Go back and watch this clip, and then you'll see. I like Triluma, by the way. You might give yourself a break. Do what your doctor says. For my patients, I give them a break for 2 or 3 weeks off of Triluma every 2 to 3 months. Dr. Joy, will you be putting PDRN in any of your skincare? God, I'm so glad you asked. I have PDRN, amazing PDRN, in my sheet masks. So this is a new exosome sheet mask. I don't have my PDRN exosome mask on the road. I got it stolen from another provider who begged me for my PDRN masks yesterday. You can't travel well with a lot of masks, sheet masks, through. I tried to go through once through security with 100 sheet masks, but there was too much fluid, even though each one's only a few mils of fluid. They said I couldn't get through, caused a problem. So some countries don't let you travel through with high volumes. But I have, this is exosomes, and I have a PDRN sheet mask. It's next level. It's there now. And I made my sheet masks so they're $3 if you bundle them. And that's about as inexpensive as anyone in the world can make a legitimate sheet mask, compostable, no microplastics in the sheet, that works well, that's legit. $3. And I've done that. Took a lot. But it was, it's out there. Here's, I was fortunate to get treatments from you twice in Portland. I would love to get another treatment from you. Are you seeing new clients anywhere? Great question. Thank you for coming in to see me to get treatments. At this time, especially in the next month or two in the United States, I won't be around or in a clinic. Most of my work right now is globally for the next foreseeable month or two, but keep in touch with me. So PDRN needs to be in your products. Yeah, PDRN, I don't know. We probably don't have a picture to show you for my team, but you can go to store.RajaniMD, and obviously they're on sale. You're in luck. They're on sale today. So you can get your PDRN from me. Is vibration in the gua sha the right frequency for bone? Okay, great question on frequency. Everyone's still studying the frequency. I don't think the frequency, you're going to hear high frequency, low frequency. Look, it's like blood flow. So vibration increases blood flow. I did a video last week. Go look at my video on bone last week. I talked about gua sha in bone and the effect of gua sha in a study showing a marker that stops osteoblast activity, okay? And osteoblasts build bone. So it was an inferential type of study, but I don't think vibration is going to turn out to be the frequency. People are going to want to make all these videos and be bombastic and get your attention, but vibration of many wavelengths are going to increase blood flow, stimulate bone. I think that's what we're going to find in the end. There's no good studies on exactly what frequency you need, but I really don't think it's that important. And those of you who have been recommended by your orthopedic doctors or your obstetric gynecologists, your bone doctors, or when you're getting infusions because you have osteopenia or osteoporosis, or you're on bisphosphonates because of that, you know that a lot of vibration plates are recommended to you. There's no specific vibration level of that vibration plate that's been shown to be better than another. For now, just use vibration if you're into that and you like the science and the data, which I do. I think facial vibration, because we've been using it in microdermabrasions, in Prime, in HydroStyle facials for a long time, vibration in the face is undervalued. And watch my video from last week. Is there a time that's better to use red light? This is a great question. Is there a time that's better to use red light? I thought I heard it's better to use in the PM. Okay, so I learned this in China because the gals there waking up in the morning say, I can't get out early in the morning because I do all my red light in the morning. I said, why do you do it in the morning? And they said, let me send you some studies. Red light and near infrared used in the morning has been shown to be protective to the skin. And I have the studies on my desktop. I should share them at some point, for UV damage, to prevent UV damage. And there's studies. I don't like to put a lot of those videos up because people think mainstream medicine be like, that guy's crazy. But this is studied. And the gals in China use red light in the morning because, and in Korea, they don't tell me this, but obviously you see they walk around with umbrellas. They avoid the sun more than probably any other culture that I personally see because they like to have glass skin. And I love vitamin D, so I don't recommend avoiding sun personally. I get sun, as you guys know. But in the morning is how I now use red light based on what I learned in China and what I see in Korea. So, but you can use it any time of the day. There's no magical time. But if you want to harness the UV protection, and you can look now at the studies because you got AI to look them up now. There's studies out there supporting that. I didn't believe it, but I saw that. So using it any time of the day is great. Morning can be beneficial. Let's do a couple more. I got to go down and see. Let me see if they're going to. I should text them while we're live and say, are you giving me my Ulthera treatment today or not? That will put them under pressure. Do I really want it? Well, I don't know. If I do, I'll film it a little bit. But, it's always nice to get a little facial treatment. $4,000 treatment, I guess. I'll go get it done. Love using any of the, who is that? Let me give you a little credit. Mary DG. Love using any of the sheet masks before going out. I should put mine on now, knowing I'm going down to the show in a couple of minutes, but I do too. I love using them before I go out. They just make you look younger. Korean sheet masks. I don't care whatever brand you use that you're happy with. It's great. You guys use different ones. Obviously, I love mine, and I make them specifically with the right sheet. I put a bunch of essence in there so you can use it on the body after. You can put mine on for up to an hour. I use them on the plane. On the plane, even though it's super dry, I put mine on. I leave it for 45 minutes. Watch my videos, do what I'm doing, work a little bit. I see more and more people on planes using them. And I did not start that trend at all. Where did I see it? I was flying to Korea a few years ago, and there was a family in front of me, mom, a boy, and a girl. The kids were like in their 20s. The mom was probably 60. They all had Korean sheet masks on. And I learned it. You go onto a flight that's going to Korea or Japan, it's guaranteed someone has them. I will white knuckle your gua sha device to my grave. You'll have to pry it out of my cold, dead hands. This is from Victoria Gates. I got to save these messages and make a video of them. I love that. I absolutely love it. I get compliments on how my skin looks at all time. Victoria, if there's a device that someone told me 10 years ago, because they did, and I said it was a hoax, and I started trying it because so many people in Asia used it, that blew my mind. And I'll include Botox in late 90s. I'll include everything. That blew my mind for that it works in the results. And I'd like to use a very bad word to people that go on, particularly plastic surgeons go on and say it doesn't work. They go online and YouTube and they say it, and I use a derogatory comment. I'd laugh about it, but I'm all in good humor. But the one that shocked me, that did way more than I ever thought it would do, it's gua sha. And of course, people make fun of me for saying it. I can tell you, there's 3 practices here at this conference. There's more, but at least 3. I could take you to the rooms right now. They have my gua sha in the rooms, and they do Botox and fillers for a living. And 1 plastic surgeon, and they use my gua sha. So I don't need, the gua sha is next level stuff. And of course, I know the mechanism behind it now, but adding vibration, red light, and everything to it, next level. Nanofacial, what I think of it, I love it. They have vibration step for legs now. Yep, use it for your whole body. But then if you're using it just for legs, you might as well use a vibration plate. Watch my video on that, and I outlined a few that you can purchase. Thank you for gua sha with the red light. Wouldn't the red light be reflected off of the oil on the skin? Right. So I do a demonstration in the last live. I don't have everything here with me. Let's see if it will work with this. So here is red and near infrared coming out here. Okay, so you can see, the camera's not going to pick it up, but you can see near infrared goes right through your oils. Yes, you can be a little bit correct. You can be quite correct about red. So there's red, 630, near infrared, 830. The red light will be a little bit affected by the oils. Sometimes I use DEJ boosting serum. Obviously, that will be on sale today too, because I want to travel with something. So I don't bring the oil. It's harder to bring an oil on a plane. So if I put DEJ boosting serum on, Nectafirm as well for the neck, I'll use that combination, and then I'll put this on with vibration. The near infrared, there's enough slip right here, and it's a lighter oil. So if you're worried about the superficial red, I'll turn the vibration off for noise. Then you can use DEJ boosting serum for your gua sha, next level stuff. But the near infrared, you can use your oils. And I think the red will have a good effect too, but the near infrared goes deeper. That's your bone, that's your deeper fat layer. So if you're worried, mix it up. Sometimes use your DEJ and your Nectafirm with it. Works amazing. So, and just, God, that's good stuff. I can sit here and just talk to you and do it. But once you start using gua sha, that's it. You'll take it everywhere. Yeah, and it's relaxing. Yeah, gua sha is relaxing. 68, use your LED mask, NUA, Plasma Go LED lip and mouth. Right there, you're so far ahead. And Halo, but I still need more improvement on my perioral area. 68. Any suggestions? I'm going to start your microneedling kit today. That's what I would start. Lip and perioral area. That's the missing link for you. Is probably going to be microneedling. Start your microneedling. You got plasmasomes in there for one, which are healing. Start on that every 2 weeks. Work yourself up every week, week and a half. There's going to be weeks you're going to forget it. There's going to be weeks where you can do it every 7 days because it's going to be on your mind and you're going to be close. That's fine. But start it and use that steadily for 2 to 3 months and report back to me. Let's see. Did you say you're on NUA? You're on NUA. Okay, great. So that's your at-home regimen. And then if you get the microneedling kit, then you're going to get Nectapherm for free. That's how I read. That's how I read. You're going to have spent enough money, over $250. You're going to get Nectapherm for free. You're going to see a result with your Nectapherm. Put your Nectapherm on your jowls, but also just up along the jawline. And then report back to me. Remember, I have a free course. You don't even have to buy anything, but on microneedling. I want you to do your microneedling with the plasmasomes on cleansed skin. And then plasmasomes after. If you want to use Nectapherm in combination, you can use Nectapherm the next morning, do your microneedling at night, or wait about 30 minutes to an hour and use Nectapherm after microneedling. But you'll get your Nectapherm. That's going to be super cool for you. And I can guarantee you see a result. I'd love to say I guarantee everything. There's always exceptions. It's medicine, but that's a rock star combination. Absolutely. The next step for you after that is going to be PRF or a bit of Sculptra. That's how you step that up. Red light in nature is most at sunset. Yeah, I did a video. In fact, I did some clips of it in this room. I'm going to have one out on red light. I was trying to do it for Tuesday. It probably won't be till next Tuesday because I'm flying tomorrow night to Asia. So you're not going to have that one, but I cover that in that red light video. I think I'll title it exactly how red light works, but within there, I cover your house lights, what you're getting from that, what you get in the morning, what you get in the evening from sun, and why red light is different and how to accentuate the best red light without UV exposure. Because the sun has great red light. The problem is to get the amounts of red light you might want to boost your mitochondria, you're also going to get the UV, A and B and C, A and B and C that's going to aid you. Would you combine the use of red light under the eye corrector with Plasma Glow mask, or is the mask sufficient? Would you combine the use of red light under the eye? Oh, so Plasma Glow Duo with the Plasma Glow mask. So the mask with the new Halo mask has PEMF. So that you could, if you're picking and choosing what to buy, I would then skip the Duo if you're going to buy the Halo, because both of them have PEMF, and add something like plasmasomes, because the under eye, remember, you want to brighten it with niacinamide, tranexamic acid, and the pointed synthetic exosomes. So instead of buying the Duo Glow, you could do that. Now, if you have both, certainly you're going to get a benefit of having the lights a little closer. You can travel with the Duo Glow a little bit easier. And some people would say, well, it's easier to put on. So you're going to remember to do your under eye more than you would otherwise. That's up to you when you're in your routine. But yeah, the mask has PEMF and all the benefits of the Duo Glow. Can't wait to try the Nectapherm Jack's Place. I'm excited for you. It's literally, it's one of my favorite products, like Voluphyline. I like that a lot. Can lip and mouth device help with receding gums? So there's no study that I have that I can sit here and go, yeah, we studied gums on day 1 and day 40th. What's clear is red light decreases inflammation along the gum line. There's data for that. There's studies for that. Again, I put that video up. That will be probably a few weeks till you guys get that, but I have data and studies. But you want to decrease gingivitis. The majority of people don't know that they have gingivitis who have it. Okay, so by decreasing any inflammation along your gums, that's a good thing. Red light has done it. What did they study? What wavelengths? 630 to 980. 630 nanometers to 980. That's what the studies that have been done for the most part in the mouth that showed it beneficial. The ones I added in here, remember 630 to 980. In your lip and mouth device, it looks like this one is put together. In this device, you're going to have for red light, which is what we're talking about. So not cold sores, not teeth whitening. You have 605. You have 630. you have 660, you have 830, and you have 880, all in this device for your mouth and gums. And forget just your mouth and gums. What about your lips? Because when your lips look younger, you want your gums to look younger, you want your lips to look younger. So yes, but reseeding gums, when you ask your dentist, what do you think about it? Any dentist who's up on their work and their knowledge, they're going to tell you the benefits of red light in the oral cavity. So that's what I'll say to that. But is there a specific study showing that? I didn't come across one specifically. There is one that shows when they remove plaque, I forget what they call it in the dentist's office, but deep below the gum line and up top, hooking, they call it. They did it with and without red light. The red light group did a lot better statistically. So there's studies like that. Is PMF in the first face mask? No. Can we use NUA if we have face filler? Yes. Many of my patients have face filler, use NUA. Okay, you got that. What's your secret for your endless energy at 40-year-old tired all the time? Passion. I think the times when I'm beat this weekend, by the way, like, yeah, I went to a Valentine's party. Yeah, I talked to the people that did a lot of the studies yesterday, but I came home early. So I was in bed by midnight. I had no, I woke up tired this morning. Like, so my endless energy, cafe for one, but passion. Like, I'm so stoked to go down there and talk to all the different companies, see what they have going on. Obviously, I have a lot of friends down there. There's a lot of people I want to confront over the studies and data to kind of dig in. So I want to do that. This is them now, right there. There's the first text. I said I'm free at 2:16. So, but honestly, you have to have a passion, and it's in your routine. But I don't know if they have endless energy, but I just keep plugging away. You just keep going. I love what I do, and I like the community here. I appreciate it. Masks can replace a lip device. No, the lip device is very different. We outline that on the website. So I got to go down there. I might get an Ulthera. I'll post you pictures if I do. I'll just get it done down there. You have all the data you need. I'm going to put this live up so that you can watch it. What I do ask of you is to like it. I ask that you share it with your friends. Help us grow here. I want to give you more products, more discounts, better stuff. I want us to have more power in the field to where I can say, okay, this new device is coming. I want to be able to send you there, get you a deal on in-clinic stuff. All those things we can start to do, the bigger we get. And I don't need a cut of that. This is just what I do. It's my passion. You get your success gives you a cut of things. That's not my goal here. But I want us to grow. But we want good people. We don't need just anyone. So send me your best people. And I appreciate all the feedback. The feedback you give me helps me grow and helps me know the direction we're taking. And yeah, I wore this last night, so I'm going to change. I'll keep you all updated. Watch this after. Thank you to everyone. Thank you to my team, my customer service team, all my team behind the scenes. Of course, we're growing, just sending you the products. The customer service beyond, the people that helped me put this together, of course, they are 99% of it. I'm just the guy here talking. So thank you to all. Have an amazing day and happy Valentine's Super Weekend.